Hello, hi everyone. Okay, just a second. Okay, hello everybody. So, good evening, guys. Good evening, everybody. Okay, so yeah, okay. So, am I audible and visible, everyone? Okay. All right, so I know it's really early after your exams, and trust me, it is like the first recall that we're doing currently, okay, with the first subject, which I've heard has come very tricky this time, hai na? It has come really tricky. That's what the feedback I got from students, ki ma'am, it was very tricky, and it was not like the previous years, but still I'm sure you must have managed it, okay, क्योंकि कुछ questions were conceptual, I would agree to that, but yes, I think कि तुमने कर लिया होगा. All right, so it's too early for a recall, so whatever questions I've been able to gather from the students itself, I'll be trying to discuss it. Please do not penalize me if I do not give you the exact question or the options, because अभी exam हुआ है and अभी हमें भी questions मिले हैं in different formats, so I'll just try to present it in a very close manner to which it was in your exams. ठीक है, so कोई बात नहीं, एक बार questions देखते हैं. Maybe after looking at the questions you'll get some confidence. ठीक है, everybody, शिवानी, गौरव, तानिया, साउंड, everybody अब relax हो जाओ. If you want you can go through the question and answers with me with a cup of tea, coffee. ठीक है, and in between I need your help actually to improvise on the questions, guys, with the options, because जो मुझे मिले वो मैंने डाल दिए हैं. But in case you want to tell me, ma'am, question was this or option was this, please tell me so that I can add it. And you will also get like on the PrepLadder app, we will be taking PYQ separately. I mean this session's questions separately. So we'll just start quickly and have a look at the questions. Okay, thumbs up everyone. ठीक है, कोई रोना नहीं है, कोई sad नहीं होना है, आराम से just listen to the answers and help me out with the questions and the options. Okay, chalo. So as I said, this is purely recall based, and it might not be very close to the actual questions, but we'll try to still look at some of the answers. Okay? All right, so we are talking about PSM now. This was a chocolate question, a very good question. ठीक है, good question बोलते हैं इसको. What did you mark for this? I did not even bother to get the other options, or I did not pressurize students कि मुझे और options दे दो, because whenever we study anemia मुक्त भारत, हम लोग हमेशा बात करते हैं 6x6x6 strategy. ठीक है, very good, मजा आ गया पेपर में. So many things I am getting to know from the description below. ठीक है, आराम से बस keep giving me your answers. What did you mark for this? We all know 6x6 strategy is followed in anemia mukt bharat. If anybody wants to share the other options, you're most welcome to give it to me. होगा anemia mukt bharat. All right. इंटरनेट बंद कर देंगे, मैं भूल गई. बोलती हूँ. Internet. Okay, I think we'll continue. Can you hear me now, everybody? Okay, now is it audible and visible? ठीक है, can we move to the next question, everyone? Okay, all right, chalo. So look at this question now. What is the labeled arrow in the slide below? Okay, so this was a picture which was given to you, right? And we know that it is rule of halves. So every time we do study about rule of halves, okay? We do study about rule of halves, okay? This time they went a step ahead, and we all know that rule of halves is for hypertension. We've looked at this image also. What they asked for was कि ये वाला जो portion है, I think this this one, the yellow portion was asked, right? The yellow portion in the graph was asked. Yellow portion in graph was asked. ठीक है, yellow portion in graph. ठीक है, so yellow portion in the graph जो पूछा गया था, what was that everybody? The yellow portion in the graph. So you can look over here. ठीक है, adequately treated. Okay, yellow portion in the graph was adequately treated. So that was the answer. If you got other options as well, yellow portion जो graph में है adequately treated है. All right, yeah, we've already discussed अनीमिया मुक्त भारत, जिसमें 6x6 स्ट्रैटेजी था, 6 बेनिफिट, 6 इंटरवेंशंस, 6 बेनिफिशियरी, 6 इंटरवेंशन. दैट वाज द फर्स्ट क्वेश्चन. ओके, दिस वाज रूल ऑफ हाउस फॉर हाइपरटेंशन वेयर यू वर आस्क्ड अबाउट द येलो पोर्शन. सो येलो पोर्शन रिप्रेजेंट्स द एडिक्वेटली ट्रीटेड. ओके, सो उसके बाद द लाइटिश ब्लूइश वन इज द इनएडिक्वेटली ट्रीटेड वंस. ठीक है, but this definitely comes rule of halves तो पूछते हैं. Okay, in the lectures we have discussed कि what is rule of halves. ठीक है, this time they asked you from the image itself. Okay, चलो, moving to the next one. What did you do for this? This is a repeated question, I would say. All right, this is a repeated topic, I would say. In fact, repeated topic है ये guys. Number of live births per 1000 women in reproductive age group. Number of live births. वेरी गुड आराम, ये तुम सही कह रहे हो. पेपर ऐसा बनाओ कि 4 लोगों से मिलके ना बचे. अच्छा, okay, what is the answer to this? So this is what we are talking about, the fertility indicators, guys. Okay, fertility indicators. I'm sure you must have been able to do this. Number of live births per 1000 women in reproductive age group. So what did you mark for this? Total fertility rate? No. Total fertility rate क्या होता है? The total number of children. Okay, total number of children that a woman of reproductive age group right from 15 to 49 years is going to have. ठीक है, वो total fertility rate है. Net reproduction rate is what everybody? Net reproduction rate is total number of girls, but what do we consider in this? Total number of girls considering mortality. Okay, considering mortality. All right, considering mortality. Here your answer was number of live births per 1000 women in reproductive age group. So this is what? General fertility rate. How many of you marked this? And we've always studied. Okay, so there was one crude birth rate होगा, crude birth rate in the option होगा, so that is not the answer. Crude birth rate is total number of live births per 1000 mid-year population. ठीक है, फिर because everybody in the denominator mid-year is not exposed to childbearing, so हम लोग क्या करते हैं? We put it as women in reproductive age group. So here the answer was number of live births per 1000 women in reproductive age group, so that becomes general fertility rate. ठीक है, no, this question is not post PG level. Okay, ये question बहुत decent question है from the topic of fertility indicators, which I hope you had studied and gone. We've discussed in our rapid revision sessions also. Everybody with me? चलो, good Vinish, everyone. Okay, please don't worry. एज, अगर एज स्पेसिफिक फर्टिलिटी भी था तो भी वो आंसर नहीं है. ओके, इवन इफ इट वाज एज स्पेसिफिक फर्टिलिटी रेट, स्टिल दैट इज नॉट द आंसर. योर आंसर इज जनरल फर्टिलिटी रेट. ओके, ऑल राइट, मूविंग टू द नेक्स्ट क्वेश्चंस. ओके, समथिंग अबाउट ट्रायज. वेरी गुड राज. ऑल राइट. Okay, specific age fertility rate is also not the answer for that question. Okay, which of the following is correct about triage? Now I got a very mixed answer for this. ठीक है, बहुत सारे मुझे options मिल रहे थे that मैम ऐसे पूछा है, ऐसे पूछा है, but now we all know red तो ambulatory कतई नहीं है. What is ambulatory, guys? Which color is ambulatory? We all know green is ambulatory, right? In such questions, all you can do is you can rule out your options, right? So we know green is ambulatory. That was gone. Is black for minor injuries? Absolutely not. Black किसके लिए होता है everybody? Black is for dead or moribund. ठीक है, black is for dead or moribund. ठीक है, all right. Red तुम्हारा है highest high priority. Okay, red is high priority. तो ये भी नहीं है आंसर. Green, is it life threatening? Absolutely not. Green is ambulatory. So was this a very tough question? I don't think so. इसमें बस इन्होंने ये लिख दिया that yellow, when we talk about yellow category, guys, we know that for yellow we have to wait up to 24 hours. ठीक है, so yellow में 6 to 20 24 आवर्स आप वेट कर सकते हो. मीडियम प्रायोरिटी है, राइट? इट इज मीडियम प्रायोरिटी. सो हियर येलो स्टेबल नीड्स ऑब्जर्वेशन, देयरफॉर दैट बिकम्स द मोस्ट सूटेड आंसर. हाउ मेनी ऑफ यू डिड दिस करेक्ट? ये मत गलत. आई होप यू हैव नॉट मार्क दिस रॉन्ग. ठीक है, दिस इज अ रिपीटेड टॉपिक एवरीबडी एंड आई एम श्योर यू मस्ट हैव डन इट करेक्टली. थम्स अप गाइज. ठीक है, ये तो सबने सही किया है ना? वी टॉक्ड अबाउट ट्रायज अ लॉट ऑफ टाइम्स, बट आई मस्ट एडमायर द वे they've put the question. They've just, you know, yellow ko instead of putting it in a very direct way, they have written stable needs observation. ठीक है, all right. चलो, there might be a little variation in the options, but we are trying to get to the closest one, so please don't worry. ठीक है, again विटामिन ए. विटामिन ए बहुत बार आता है, हमेशा हम लोग लास्ट मिनट विटामिन ए को रिवाइज भी करते हैं. सो नाउ आई हैव गॉट अ वैरिड variety of question, all right, for this vitamin A. Some said ma'am it was treatment, some said it was preventive. मतलब बहुत तरीके से ये question आया मेरे पास. So what I could get close was in endemic area. Somebody said ma'am it was mentioned this word, somebody said it was not mentioned. Whatever it is, okay, if it's mentioned endemic area, at least they did not mention the treatment. Okay, so we are talking about indirectly the preventive doses. So now tell me, option A, 2 lakh international unit orally for 6 months, 1 lakh international unit for 6 months, 2 lakh for 6 weeks. ये तो बिल्कुल नहीं है. 2 lakh international unit for 1 year. Okay, so if it was prophylaxis also, very good. So prophylaxis also, we all know guys, vitamin A, this was a good question. I would say a good question. Also I would say it was a repeated question. I mean repeated topic. Question तो नहीं, repeated topic, right? अगर prophylaxis mentioned था, very very good. So if prophylactic dose was mentioned, it becomes way easier. Okay, prophylactic dose अगर mentioned है, it becomes extremely easy now. We all know vitamin A, everyone बताओ. 9 months, 9 completed months, we give 1 ml or 1 lakh international unit, right? Thereafter every 6 months till 5 years, कितना देते हैं? Till 5 years of age, we give 2 ml or 2 lakh international unit. And what are these doses guys? Orally. So the closest we can get to was option A. ठीक है? Yeah, overall the paper language was bad. Okay, that's what Abdul is saying. Okay, I would say the paper language was tricky. Okay, now they've started playing a little bit with words also. Okay, so it's not like the questions were tough. It's just that कि हमारे ना words के साथ खेल रहे हैं. So you might get confused in that manner. So that is why every time क्या बोलते हैं? Practice करो MCQs. ठीक है? Practice is what is required. ठीक है? Alright, so let us go to the next question now. So 2 lakh international unit orally for 6 months. Okay? Alright. Which of the following is indirect cause of maternal death? Was this question there? I hope I'm audible and visible. अब तो ठीक है? I hope I'm audible and visible. ठीक है? All right. इसका आंसर क्या लगा? Repeated topic must know. Repeated topic must know. MCQ है. Repeated topic must know. Answer दो. ये हम लोग ज़्यादा discuss भी नहीं करेंगे. Anemia, right? If this was the question, indirect causes anemia. And in case, since some of you sent me, ma'am, direct cause पूछा था, तो direct cause becomes hemorrhage. ठीक है? Indirect cause becomes anemia. Direct is hemorrhage. ठीक है? All right, चलो moving to the next question guys. Urban health care is not included in, ऐसा कुछ question था. I don't know the exact word for this. All right, or which is not a part of urban healthcare delivery system, which is not a part of urban healthcare. So healthcare delivery system हमेशा आता है. बताओ, urban healthcare delivery system, whenever we study, how do we study it? Whenever we study urban healthcare, okay, so what is it? All right, what is the option over here? Which of the following is not? So now whenever we study guys, अगर rural की बात करते हैं versus urban, एक मिनट सुन लो. In primary level, okay, in rural you have sub-centers and PHCs. They are now being upgraded to health and wellness centers. ठीक है? Secondary level we have CHC, sub-district hospital, as well as we have district hospital. ठीक है? All right, and at tertiary level हमारे पास मेडिकल कॉलेज एंड सुपर स्पेशलिटी हॉस्पिटल होता है. गाइज लेट मी फिनिश, देन आई टेक अप योर डाउट्स एंड क्वेरीज एंड वी कैन वर्क ऑन द ऑप्शंस. ओके, इसमें सब सेंटर ही है, ठीक है. डजंट इंक्लूड व्हाट कंपेयर टू. ओके, सो अर्बन हेल्थ केयर डजंट इंक्लूड. ऑल राइट, whatever fashion was there doesn't include. So when we talk about urban healthcare at primary level, we have urban PHC, and now we also have urban health and wellness centers. At secondary levels you have CHC, all right, metro city, non metro. At tertiary level medical colleges. So क्या हो गया तुम्हारा आंसर? Yes, the question is there, but question was like what all are included except. ठीक है. So when you talk about except, we never say that sub-centers are a part of urban healthcare delivery system. They are always seen in rural healthcare delivery system. Urban में CHC होता है, all right. Urban में CHC होता है for metro city as well as for non-metro city. Okay, and also district hospitals are again there. ठीक है. So it's not necessary that अगर district hospital है then we'll not have an urban CHC. It's nothing like that. Okay, so the closest that we could get to this was that one. All right, now look at this next question, guys. A chronic alcoholic patient presents with loss of coordination, confusion and unsteady gait. Which vitamin deficiency is most likely seen in this patient? इसका आंसर क्या है? This was a pretty good repeated topic. It's just that they have not asked you directly. I'm sure ये सबने सही किया है, ये सबने सही किया है. What is the answer to this? What is the answer to this? A chronic alcoholic presents with loss of very good vitamin B1. ये तो हम लोग हमेशा ही पढ़ते हैं, right? B1 thiamine deficiency is seen in, so this was a chocolate question. Okay, this was a chocolate question. All you had to do was make out कि हाँ loss of coordination, confusion, unsteady gait. ठीक है. Chronic alcoholic was the hint over here. So thiamine deficiency is seen among chronic alcoholics. Chronic alcoholics और वो किससे present करते हैं? Vernix encephalopathy. Okay, so this was a good question. Vernix encephalopathy. Encephalopathy. All right. Any doubt in this? Any doubt in this? Okay. चलो next one. Let's see. I hope everybody marked this correctly. ये तो तुमने सही किया है, ठीक है. All right, thiamine. All right. Okay. Something like this was there, guys. In an experiment, 39 was the highest number, but was mistaken was for 93. What will it affect? See, guys, we have just finished the exams. Okay, it's a recall what we've collected from the students, what I was able to get. So I might not get very close to the questions or the options. We are just, having a relaxed session here. इतना भी इसको don't take it to heart too much, okay, because unless and until I've actually seen the questions we cannot get very close to it, right? But that's what we are trying. So the wordings might not be the same, the options might not be the same, but we are trying to get closer to it. Okay, so इसमें क्या है answer? What is the answer over here? In an experiment, 39 was the highest number but was mistaken for 93. Now we always know that biostats का question तो आएगा ही आएगा, ठीक है. And if you remember, in our lectures we have done a similar question where instead of writing 500, a person had recorded 5,000. That is what we had discussed in our sessions also. So somewhat this was asked. It's not very difficult, guys. तुम बताओ what was the question? What should be the answer? Now you know what is mean. What is mean, guys? What is mean? So we all know mean is sum of all observations, ठीक है. Sum of all observations, okay. Mean is sum of all observations divided by the total number of observations, okay. Mean is sum of all observations divided by total number of observations. Now if instead of 39 I have to add 93, mean will increase, है ना. Instead of adding 39 in the numerator I ended up adding 93. तो imagine करो mean तो बढ़ ही जाएगा, mean will remain same. No. Mean will it remain same? No. Mean is going to increase. All right, mean is going to increase. Median will increase. Does anything happen to the median, guys? Does anything happen to the median? What is median, everybody? Median is the middle value, right? Median is the middle value when data is arranged in ascending or descending order. ठीक है, जब आप data को ascending order में arrange करते हो. So median is the middle value. So this 39 को आप 93, it was the highest number. So 93 will go towards one end. So will median increase? No. Median will remain unaffected. Median will remain unaffected. Mean, median both increase? Absolutely wrong. तो आंसर क्या हो गया? Mean will increase but median will remain the same. Did you all understand this question? Mean बढ़ जाएगा but median is going to remain the same. Yes, because in the numerator we'll end up adding all the options, all the numbers. So instead of 39 we are adding 93, right? So mean बढ़ जाएगा, but what about the median? 93 is the highest, so that will go towards one end. So median will not be affected. ठीक है? Median would not decrease. Median will not decrease, not at all. Median will remain the same क्योंकि highest number goes to one extreme. All right? Okay? चलो. Median decrease नहीं होगा बेटा. Even if there was an option which says that median will decrease, it is wrong. Okay? Mean will increase but median will remain the same. All right? I have explained to you. I hope you understood, everybody. All right? Many congratulations, Rahul. Chalo. Which international agency helps in construction of sanitary latrines or toilet building in India? ठीक है, what is the answer to this? Or somebody said, ma'am, it was written funding or something. What is the answer to this? USAID, something cure. I don't think it should be cure or some option. Red Cross, yeah, Ford. Okay, I'll come back to that question again, Aradhana. Okay, let's just look at all the other questions, then we will come back. Okay, so which international agency helps in construction of sanitary latrines, everybody? So what is your answer? Okay, Aradhana is writing D. So I'll show you a line from It Was Care. Yes, that's what It Was Care. Okay, I'll show you a line from our textbook. Okay, Ford Foundation helps in designing and construction of hand-flushed acceptable sanitary latrines in rural areas. Okay, so if you had Ford as the option, you will go for that. That's what I feel. अगर question यही था sanitary latrines के बारे में, then the closest, see, USAID is helping in sanitary, in environment, sanitation and all that. But here it was particularly written sanitary latrine construction and all that. So it was Ford. Okay, that is what is helping in it. Okay, if these were the exact words which came in your exam. Okay, we are trying to get to the closest, guys. Okay, maybe the question was asked in slightly different manner. That doesn't matter. But अगर sanitary latrine ऐसे पूछा है, then your textbook also mentions this line, designing and construction of hand-flushed acceptable sanitary latrines in rural areas. ठीक है, Rockefeller was also in the option. ठीक है, but if Ford was there, that will be your question. ठीक है, that will be your answer. Funding था तो भी it will be Ford Foundation. ठीक है. All right, next, diabetic screening for pregnant women is done at which trimester? I think that was a pretty decent question. ये तुम OBG में भी consider कर सकते हो, ये तुम PSM में भी consider कर सकते हो. What is the answer, everybody? What is the answer to this? I'm sure you know this. 24 to 28 weeks, 32 to 36 weeks, 18 to 24 weeks, 14 to 18 weeks. What was the answer to this? If they asked you diabetic screening, okay, then for diabetic mother, all right, so what will be the answer? Agar if the question looked like this, we all know it is done around 24 to 48, 24 to 28 weeks, all right. First one option is first antenatal visits. See, ideally diabetic screening, we do it at 24 to 28 weeks. Now, if the woman is coming at 10th week, 12th week, first trimester, 15th week, 16th week, we are not doing, right? Ideally, तो वो 24 से 28 weeks ही होता है. Even if she is running up in the first trimester, will I do right that time? No, unless of course कुछ बहुत high risk है. ठीक है? So considering that, we will have go for 24 to 28 weeks. ठीक है? Go for 24 weeks. ठीक है? All right. What was this? Identify the graph. Did you get this question? Identify the graph. First visit 24th week. Okay, let me write it over here. Even if the options was first visit, all right, even if it was first visit, दूसरा क्या बोल रहे हो? 24 weeks, 18 weeks, whatever it was, the nearest we would go to is 24 weeks. ठीक है? That again becomes your answer. All right. Okay. Diabetic screening is done in 24 to 28 weeks. What was the answer for this? Identify the graph. Did they ask you about the identification of the graph? Okay. All right. What is your answer to this? Point source single exposure. Point source single exposure ऐसे होता है. Rapid rise, rapid fall. ठीक है? This was point source single exposure. Okay. Point source single exposure. ठीक है? So this is not the answer. Common source continuous में we have studied there is a plateau phase, right? It is something like this. There is a plateau phase, guys. So again, this is not the answer. This was propagated epidemic, person to person transmission done in image based sessions. You have a shorter plateau. ठीक है? यहाँ पे shorter plateau होता है. You have a shorter plateau phase and it's not a very smooth rise. Look, there are hiccups. It's a bumpy rise. Okay, it's a bumpy rise. You can let me know the options over here. But if this was the graph, please remember ये है propagated epidemic. Okay, this is what? This is propagated epidemic, everybody. Okay. All right, whatever was the question, if this was the graph that they turned up in your, that they gave in your exams, ये हो गया तुम्हारा propagated epidemic. ठीक है? Intermittent option was also there. It's not intermittent. I'll show you how the graph of intermittent looks like. Okay, intermittent exposure ka I'll just show you the graph how it looks like. Intermittent exposure or intermittent source. This is intermittent exposure. Okay, ये ऐसे होता है. This is intermittent exposure. Shorter plateaus like that. Okay, this is intermittent exposure. All right, but if the graph was this person to person transmission, unless and until we find one person whose immunity is poor, like epidemics of hepatitis A, all right, we will not be able to transmit the disease. So that is why bumpy rise and a shorter plateau phase. So this becomes your propagated option. Okay, अगर exact graph था guys, then it is propagated epidemic. All right. Okay, then what was the option? Can anyone tell me what was the option for that? If it was not propagated, if this is the graph, it is propagated option, propagated epidemic. Maybe they could have given person to person transmission. ठीक है? Person to person transmission, something like that. You can tell me the options. We can add it. All right? Okay. Chalo. Now, please tell me what was the question for this. What is the delivery criteria in PHC? Did they mention type A PHC? Did they mention just PHC? What was the question? We can improvise in this also. If propagated was there, वही answer है. ठीक है? PHC number of deliveries 20 and less. Okay. अगर type A PHC था और if it was not even type A PHC, ठीक है? If it was type A PHC, we all know it is less than 20 deliveries per month. ठीक है? PHC number of deliveries 20. ठीक है? No mention. They mentioned type A. Okay. If type A was mentioned, less than 20 deliveries per month. Okay. And if they mention type B is more than 20 deliveries per month. Okay. More than 20 deliveries per month. Agar just PHC mentioned tha, alright, so you have to tell me the option. If it was just PHC, if they just mentioned PHC and they had given less than equal to 20, okay, if they had given something equal to 20, all right, if they had given less than 30 something, all right, the answer becomes less than 20 deliveries per month, because we are first going to deal with type A PHC only. ठीक है? Okay, so less than 30 equal to 30, ये तो बिल्कुल नहीं है. Okay, the cutoff is 20 deliveries. All right, the cutoff is 20 deliveries. Even if it was just PHC, the cutoff is 20 deliveries. Guys, this was a repeated topic. Healthcare delivery system में we always study about us type A and type B PHC. Type A PHC is less than 20 deliveries per month. Type B PHC is more than 20 deliveries per month. Is it okay? All right, everybody. चलो 30 इज नॉट द आंसर, प्लीज रेस्ट अश्योर्ड 30 तो बिल्कुल आंसर नहीं है, ठीक है. ऑलराइट, मूविंग टू द नेक्स्ट क्वेश्चन, लेट्स सी व्हाट डू वी हैव. ओके, गुड क्वेश्चन, वेरी नाइस क्वेश्चन इफ इट वाज सिमिलर टू दिस, ठीक है. हेलो एवरीबॉडी, ओके, ऑलराइट. A 10-year-old girl came for a health checkup. She doesn't go to school. Which of the following program will benefit her? I am sure everybody has done it correct. Type A में less than 20 deliveries. ठीक है, trending star. Okay, all right. A 10-year-old girl came for a health checkup. She doesn't go to school. कौन सा program benefit करेगा? She doesn't go to school. वो school नहीं जाती. Yeah. What were the options over here? Can anyone tell me? ICDS था ना. Okay, अगर ICDS था option में, she doesn't go to school. So I hope you did not end up marking midday meal. If she is not going to school, will she benefit from midday meal? If she is not going to school, will she benefit from midday meal? Absolutely not. नवजात शिशु कार्यक्रम अगर था तो ये भी आंसर नहीं है. That's for a newborn baby, right? To नवजात शिशु कार्यक्रम where we are training healthcare workers, okay, for postpartum care, okay, वो भी छोड़ दो. For a newborn care and immediate resuscitation तो वो भी नहीं है. All right, जननी सुरक्षा योजना is for institutional deliveries, that is also not there. राष्ट्रीय बाल स्वास्थ्य कार्यक्रम is not going to, yeah. Okay, so if it was ICDS, was ICDS in the option, ठीक है. अगर ICDS ऑप्शन में था, बिकॉज राष्ट्रीय बाल स्वास्थ्य कार्यक्रम में ना 0 to 18 years में वी आर स्क्रीनिंग फॉर डिजीजेस, ओके, वी आर स्क्रीनिंग फॉर डेफिशिएंसीज, वी आर स्क्रीनिंग फॉर डिफेक्ट्स एंड वी आर स्क्रीनिंग फॉर डेवलपमेंटल डिलेज, ओके, वी आर स्क्रीनिंग फॉर डेवलपमेंटल डिलेज एंड दिस इज बीइंग डन बाय मोबाइल हेल्थ टीम्स ऑल्सो, ओके, मोबाइल हेल्थ टीम. सो इवन इफ शी डजंट गो टू स्कूल, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम विल बेनिफिट हर. बट if ICDS was in the option, your priority will go for ICDS. अगर ICDS option में था, so if ICDS in the option, if ICDS option mark, if ICDS not option, okay, then we can go for which program will she benefit from? The child Rashtra Bal Swasth Karyakram, okay, because in that at least we are screening her for screening the child for diseases, deficiency, disorders 0 to 18 years. ठीक है. Now whichever was there in the option you can accordingly go. अगर ICDS था then of course that becomes the more closer option, but if it was not there then you will go for राष्ट्रीय बाल स्वास्थ्य कार्यक्रम. ठीक है. Okay, easy. Which of the following is used to assess chronic malnutrition? Chronic malnutrition पूछा था. Again a very good question, a repeated topic. I'm sure you must have done this correctly. ओके, नो नवजात, लेट मी रिमूव, फिर नवजात हटा देते हैं. ठीक है, वॉट एवर फॉर दिस क्वेश्चन अगर ICDS था दैट बिकम्स द आंसर, अदरवाइज राष्ट्रीय बाल स्वास्थ्य. ठीक है, ये सबको पता है, वी ऑल नो दिस इज स्टंटिंग, सो वी आर नॉट गोइंग इनटू टू मच ऑफ डिटेल फॉर दिस. यू ऑल नो व्हाट इज अक्यूट malnutrition गाइज, लो वेट फॉर हाइट. ठीक है, लो वेट फॉर हाइट इज अक्यूट malnutrition. क्रॉनिक इज व्हाट, क्रॉनिक इज लो हाइट फॉर एज. ठीक है, लो हाइट फॉर एज. क्रॉनिक इज स्टंटिंग. ठीक है, क्रॉनिक इज स्टंटिंग. अक्यूट इज वेस्टिंग और इमैसिएशन. एंड व्हाट इज लो वेट फॉर एज गाइस, व्हाट इज लो वेट फॉर एज? लो वेट फॉर एज इज अक्यूट ऑन क्रॉनिक malnutrition. ठीक है, अक्यूट ऑन क्रॉनिक. सो दिस वाज अ गुड क्वेश्चन, सबने सही मार्क किया इसको, आई होप. ठीक है, ओवरवेट भी ऑप्शन में था, जो भी है वी ऑल नो दैट क्रॉनिक malnutrition इज stunting. Okay, next, criteria of mid-arm circumference and Shakir's tape for SAM. So severe acute malnutrition. Okay, now whenever you have to talk about mid upper arm circumference, this we discuss in preventive pediatrics also. आंसर दो. इसका आंसर क्या था? वॉज दिस अ सेपरेट क्वेश्चन? आई रिसीव दिस एज अ सेपरेट क्वेश्चन. दिस एवरीबडी नोज. आई जस्ट टेक वेरी गुड इंडियन स्कॉलर मुस्कान, सबने सही किया है. दिस इज अ रिपीटेड टॉपिक. गुड गाइस, दिस इज अ रिपीटेड टॉपिक. सो इट बिकम्स 11.5. Okay, it becomes 11.5. Just look at the cutoff criteria. Red is SAM less than 11.5. Yellow is 11.5 say 12.5, mild to moderate. Okay, this is severe acute malnutrition. This one over here becomes mild to moderate malnutrition, and green of course is adequate. Okay, green is like adequate growth. Okay, everybody. Okay, so criteria of mid upper arm circumference according to Shakir's tape is 11.5. Okay, stunting is low height for each. Okay, moving to the next question, guys. Something like this came. I'm not very sure about this question, but I got something like this. HIV patient here to diagnose TB. What should be the investigation of choice? I'm sure everybody got this correct. 11.5 we'll go for Shakir's tape. Okay. What did you mark for this? HIV positive patient to diagnose TB, investigation of choice. Was this there? Any other option इसमें था? Culture, chest X-ray या कोई option नहीं था? So we all know for people living with HIV, most common opportunistic infection is ये. This is a good repeated topic. Okay, we have done this many times. This is a good repeated topic. Most common opportunistic infection in India, guys. Most common opportunistic infection India में क्या है? We all know it is TB. And what is our investigation of choice then? CB-NAT. ठीक है, CB-NAT. The first thing, why would I go for PCR when I can go do a CB-NAT? है ना, less expensive पे जाएंगे. So CB-NAT. CB-NAT will be the investigation of choice. It is a rule, guys, for people living with HIV. We always do CB-NAT. In fact, now CB-NAT is offered at baseline. अब CB-NAT is offered at baseline. ठीक है, CB-NAT अब baseline पे ही offered होता है to any person who is presenting with cough for more than 2 weeks duration. With sputum AFB, you have to do a CB-NAT. What does CB-NAT do? It rules out what? To rule out which resistance, guys? It rules out rifampicin resistance. Okay, to rule out rifampicin resistance. ठीक है. So यहाँ पे अगर PCR भी था, I per se would be going for a CB-NAT because that is less expensive when we consider, and also now it is offered at baseline to every TB patient. ठीक है, first investigation हो, चाहे they asked you the only investigation, it is CB-NAT. Is it clear, everybody? Okay, first screening investigation, then also CB-NAT. If first was not mentioned, then also CB-NAT. People living with HIV, TB पता करने के लिए CB-NAT करना है. ठीक है, चलो आगे बढ़े. Just a few more questions I have. Let me see. I got this question, but I got it in so many forms. I got confused myself कि exact question क्या आया है. ठीक है, एक्सपायर्ड टैबलेट, कोई बोल रहा है डिस्कार्डेड है मैम, कोई बोल रहा है साइटोटॉक्सिक है मैम. तो बता दो क्या था, वट एवर इट वॉज, एक्सपायर्ड, डिस्कार्डेड, साइटोटॉक्सिक, जो भी वर्ड हो. ऑलराइट, ओके. What did you mark? That was my that is the thing that we'll go for. We all know number 1 drugs, yellow bag. So ये गया, red bag out of the box, blue bag out of the box. Deep burial or anything is preferred when we don't have incineration facility. When I have an incinerator, I'll go for that. Why not? Okay. So yellow bag, incineration. ठीक है, ये सबने सही मार्क किया है ना? सबने सही मार्क किया है. वेदर इट वॉज एक्सपायर्ड, डिस्कार्डेड, साइटोटॉक्सिक, जो भी है, दिस इज अ रिपीटेड टॉपिक. इट बिकम्स येलो बैग एंड माई प्रायोरिटी वुड बी टू इंसिनरेट. ओके ओके, नर्स वॉज सपोज टू, ठीक है, नर्स सपोज टू डिस्कार्ड, जो भी नर्स को सपोज टू डिस्कार्ड. द थिंग इज विच कलर बैग यू विल डिस्कार्ड? येलो. येलो का ट्रीटमेंट डिस्पोजल ऑप्शन इज इंसिनरेशन. ठीक है, ठीक है, ऑल राइट. Can we go to the next question? Okay, अगर red bag भी था and option was incineration, it's absolutely wrong because first of all, it will never go in a red bag. ठीक है? चलो. Next question, just a few more, guys. I would not know if this was a question because I received it in a very this fashion कि मैम कुछ पूछा है, school health program is under. So can you tell me if this was the exact question or was it of some other form? अगर पूछा school health program किस में आता है, this is a repeated question, guys. Last time also they gave you, and we all know that school health program, we have done it now many times. School health program is under PHC. normally. If this was a question, please don't end up marking sub-center. School health program is responsibility of, in case it was there. I'm not sure, very sure about this question, but अगर ये question था तो ये है, ठीक है? नहीं था, ठीक है, कोई बात नहीं. All right, but it is a risk. Then we can come to the next one. MTP can be done till 24 weeks. Now this is a forensic medicine also. This is a PSM also. This is the OBG question also. Tell me the answer to this. I'm sure you must have revised MTP Act. So till 24 weeks in rape, contraceptive failure, fetus malformation. What did you mark over here? Okay, so I can see Monica is saying C, Manish C, कोई B बोल रहा है, कोई A बोल रहा है, तो बहुत सारे बच्चे बहुत सारी चीजें बोल रही हैं. तो सही आंसर क्या है गाइस? MTP Act. It was revised, right? Till 20 weeks, 1 doctor. Beyond 20 weeks, 2 doctors, right? All that you remember? Yes. अब तुमसे question पूछ लिया कब? So just have a look over here. Look over here. Less than 20 weeks contraceptive failure में you can do it in less than 26 weeks. Up to 24 weeks, this is according to our MTP Act, guys. ये देख लो अच्छे से. Up to 24 weeks in cases of rape, incest or any vulnerable female sexually assaulted, something like that. More than 24 weeks, substantial fetal anomaly. ठीक है? We can go and do MTP beyond 24 weeks also in cases of substantial fetal anomaly. Okay? That too, it has to be approved by a medical board. Okay? It has to be approved by a medical board. And also, at किसी भी time, if it is endangering the life of a pregnant woman, it can be done. And we all know that less than 20 weeks में 1 doctor है, more than 20 weeks में 2 doctor है. ठीक है? ठीक है, 24 से अगर ज्यादा होगा तो malformation. तो आंसर क्या हुआ? अब बताओ. लेस देन 20 वीक्स मैंने बता दिया, कॉन्ट्रासेप्टिव फेलियर. अप टू 24 वीक्स आई टोल्ड यू रेप, इंसेस्ट, वल्नरेबल फीमेल. मोर देन 24 वीक्स आई टोल्ड यू सब्सटैंशियल फीटल अनोमली. अब बताओ आंसर क्या मार्क करोगे फिर? कैन बी डन टिल 24 वीक्स इफ दिस वाज द क्वेश्चन एंड इफ दीज वर द ऑप्शंस, ऑप्शन ए बिकम्स योर आंसर. ठीक है? See, again I am saying that I am not very sure about the question. I haven't given the exam. I have received from all of you. So we are just trying to get closer to it, guys. Okay? So MTP can be done till 24 weeks in rape. ठीक है? All right. That was a separate question, I think, Muskan. जो the question that you are saying, no, doctors and consent, that was something else. Okay, that was another question. A child is presenting with child, I'm saying. Someone has a meningoencephalopathy, that we have. We'll discuss that also. ठीक है? But look over here. Till 20 weeks in case of contraceptive failure, up to 24 weeks, rape, incest, vulnerable female, and more than 24 weeks, substantial fetal anomaly. ठीक है? That was a separate question. कि किसका permission चाहिए? That was a different question. Okay? I think we have done this. ये वाला हो गया. Okay. Did you get this question according to SDG proposed goals? This we have already discussed, guys. पहले I have already discussed. Okay? According to SDG proposed goals towards 230, what is the target? What is the target? Was this question there? Okay. Did you have this question according to SDG? I'm not very sure about this question, but I got it. So I told you maternal mortality rate option was different. You can let me know that 60, 70, 80. Okay. So if it was 60, 70, 80, whatever everybody, सुन लो अच्छे से. Maternal mortality ratio according to SDG has to be achieved to 70 per 1 lakh live births. ठीक है? So if it was 70, तुम्हारा आंसर, इसका आंसर तो none of these है, because according to this question none of these. But if it was given option A 70, 60, 80, 90 something, all right, then your answer is 70, because SDG wants to reduce maternal mortality ratio to less than 70 per 1 lakh live births. ठीक है? And SDG wants to reduce under 5 mortality rate to 25 per 1000 live births. याद है वो न्यूमोनिक? अंडर 5 25 एंड न्यूनेटल मोर्टालिटी रेट टू 12 per 1000 लाइव बर्थ्स. ठीक है? ऑल राइट. ओके. All right, GFR wala question we have discussed, Phoenix. You can refer to the previous one. So if the question was like I have framed it, then none of the above. But if the question was 70, 60, 80, 90, तो 70 हो जाएगा, ठीक है? All right, I am not very sure about this question. Please, इसमें help चाहिए. Which is not included in Ayushman Bharat scheme? Which is not included, something like this scheme. I'm not very sure. A lot of you messaged different versions, so I thought I'll make koi question isme, you know, somehow I'll try to get to the closer option. Batao, which of the following? Okay, we'll discuss goal, aim and target. ठीक है, इसको रहने देते हैं, ये मुझे भी नहीं पता है, ठीक है. नहीं, 60 आंसर नहीं है, 70 आंसर है, ठीक है. डिफरेंट ऑप्शंस, सो आई एम नॉट वेरी श्योर अबाउट दिस क्वेश्चन. ओके, सो इफ इट वाज दिस, देन वी नो इट इज नॉट ₹10 लाख पर फैमिली पर ईयर, ठीक है. इट वाज ₹5 लाख, ठीक है. अगर नहीं था, वी कैन गो टू द नेक्स्ट वन, ठीक है. हेल्थ एंड वेलनेस सेंटर्स are in Ayushman Bharat. Okay, health and wellness centers are in Ayushman Bharat. Creation, so that is absolutely correct. Creation of health and wellness centers at primary level, we are creating health and wellness question. Okay, so if this was not, we can forget it. Then we had one question on steps approach. I have not been able to gather anything about steps approach. Can you yes, of course, it is making India healthy and prosperous. ठीक है, India healthy and prosperous, तो ये भी था ही, India healthy and prosperous. All right, this is also correct, of course. Yeah, that I'm going to discuss. ठीक है, all right. What is for this, guys? Steps approach. Do you remember? Tend to remember the option. I am so sorry, Mohin Odin. Okay, it's just a recall. So we're trying to get closer to the options. ठीक है. All right. Okay, steps approach mein you can help me out with the options. Okay, if that was not the question, fair enough, Rajshri, we can omit that question here. Okay, but there was something related to Ayushman Bharat, right? So that's what we have tried to come closer to. 6 into 6 into 6 strategies for anemia mukt Bharat. Okay, all right. All right, rule of halves we've discussed. Anybody remembers the question for steps approach? In case you do not remember, this was the steps approach where in the first one we fill a questionnaire. Second one we are taking physical measurements like height, weight and all that. And third we are taking biochemical measurements where we are taking lab measurements. ठीक है? Okay. All right. So, protein required, yeah. So let's do that protein required question. What was that question? You can tell me. Protein requirement wala question kya tha? I think it was for a 55 kg woman, right? Something like 55 kg woman hai. So please remember what is the protein requirement now. Protein 6 into 6 question we have already done. ठीक है? What was the okay, protein requirement is now we all know 0.83 gram per kg per body weight. Okay, so you can tell me the options. 0.83 gram per kg body weights, 55 tha chahe 50 tha, you can calculate it. You can multiply it with what were the options? 55 into 0.83, मतलब roughly तो 55 ही है, ठीक है, but you can, you know, multiply it, it comes around 45 something. Yeah, so it was 45, 46, whatever. So it comes around something, it comes around, you know, it comes around 45.6 something. All right, so almost 46. Okay, almost 46 something tha. So agar 46 option mein tha, that becomes your answer. Because don't, if it was 55 also, that will not be there because it is not 1 gram per kg body weight now. It is 0.83 gram per kg body weight. Okay, so 45 I have not written down. All right, if it was 46, you can go for marking that. ठीक है, 46, 55, 66 and 110. So now it is not 1 gram per kg body weight. If it is 55, it is 0.83 gram per kg body weight. So if you multiply that, you will get around 46. Okay, everybody, any other question? See guys, again, I would just like to tell you that this is a recall session. Please don't take it to your heart and मेरे पीछे भी मत पड़ जाओ इतना, because I have just got the questions. I haven't attended the exam. ठीक है, so we are getting closer to it. ठीक है, 2020 guidelines ही point NIN के according it is 0.83. Okay, All right. All right. So please remember, there was one question which I wanted to discuss. Was there something like systematic observation and recording? अगर कोई question था systematic observation and recording of activities, was this asked? Recording of activities. Okay, so इसका आंसर है work sampling. ठीक है, this answer is work sampling if this was there. Okay, systematic observation and recording of sampling. How much percentage of wage is the family entitled to? So for Ayushman Bharat, how much percentage of wage? Okay, so all right, okay. हाँ हो जाओगे, so please don't worry. And in case they asked you about goal, goal is the ultimate thing there where you want to reach. Okay, objective, we all know it is specific planned activities. ठीक है, specific planned activities. And target अगर आया था, so it is degree of achievement. ठीक है, degree of achievement. Now guys, we will be putting out exactly the same recall on the PrepLadder app, okay, in a few days. Right now we've just tried to come closer to the questions, ठीक है, so please do not I have tried to get so many questions in a very short time, ठीक है, so अगर we've missed out any questions, you can message me. I will be including that on the PrepLadder app. Okay, you can message on Telegram. Please relax, guys. And meningocele is congenital malformation के लिए. So in that we require the permission of 2 doctors. Okay, all right. So if there's any other question, please message me on Telegram. I would be very happy to answer. ठीक है, but right now this is what we could get and we could arrange. अब exam हो गया है, ठीक है. ऑल राइट, अब एग्जाम हो गया है. फाइनाइट टाइम में क्या होता है, फाइनाइट टाइम में हमेशा टारगेट्स होते हैं, ठीक है. ऑल राइट, क्योंकि गोल इज नॉट कंस्ट्रेन्ड बाय टाइम और रिसोर्सेस. ऑल राइट, so I will see you again soon. Please don't panic, please don't worry. All my request to all of you, please do not worry. Okay, try to relax and I'm sure each one of you will do very good. Best wishes. Don't completely base your marks on the recall because these are questions closer to it. Okay, I hope all of you pass. My best wishes are with all of you. Okay, you can message me on Telegram. I will get back with it. Okay, all right. Thank you so much, everybody. Have a good day. Thank you so much. Best wishes.
Hello everyone, I am Dr. Vaishnavi, your ENT faculty on the PrepLadder platform, and today we are here to do a quick recall of the questions that came up in your ENT examination today. So first of all, before we start the session, if I am audible and visible to all of you, let me know by a quick confirmation so that we can start the class. Yes, so I think the relay is working well and also good here. So let me just tell you a quick disclaimer that the questions discussed in this PPT are mainly recall-based questions, and the motive is to get the actual questions asked in the exam. So I would request you all to help me to get to the correct understanding of the questions and the options as well, so that we can give you a final questions in the app, and we will come back to you with the final set of questions. This is recall based session from the students who have given us the information on the questions. Okay. So hello Bala, I'm fine. Hello Chandni. Hello Vinish, Pushpang, Dr. Aswa, Sandeep, good evening to all of you. First of all, I would just like to tell each one of you many congratulations for having attempted the examination, for having gone to the examination and having successfully done it. I know I have learned from a lot of learners that the exam was a little bit on the difficult side. They had asked a little bit of clinical questions and there were very few image-based questions. But having said that, I'm sure that all of you will do well. And if it was difficult for you, it's going to be difficult for most students as well. So just don't panic at the moment. Just stay relaxed. Just have faith in yourself, your preparation, faith in Almighty. I'm sure you all will come out with flying colors and tell me that, yes, ma'am, you were right. We were only doubting ourselves, but now you see we've cleared the examination, and I'll be waiting to hear from all of you. Okay. So let's start the session by understanding what questions came from ENT. So let's begin with the first question. So they gave you a clinical image here, and they asked you which of the following stridor type is seen in the given image. Now here some students have mentioned to me that it was an image of laryngomalacia, while some of the students mentioned to me that if there was a patient in whom they had given an image showing subglottic stenosis indicating croup. So I don't know what was the right question asked. Was it laryngomalacia or was it subglottic stenosis? But I will help you answer both. So if we take a laryngomalacia, if this is the image that was given to you, you see that the epiglottis was folded upon itself. This is called as an omega-shaped epiglottis. So omega-shaped epiglottis is seen in a condition which we call it as laryngomalacia. Now, in laryngomalacia, what do we see? We see that the epiglottis is excessively flaccid. So we get a stridor only during inspiration because there's a negative intrathoracic pressure in inspiration pulling the air inside, and hence the flaccid epiglottis collapses on the airway, resulting in an inspiratory stridor. So in laryngomalacia, if the question was the same thing, then the answer will be inspiratory stridor. There is no doubt upon it. Because what happens during expiration is the epiglottis is pushed away from the laryngeal inlet by the positive airflow that is coming from the lungs. And hence you don't see any stridor during expiration. So in laryngomalacia, you will only see inspiratory stridor. But if the question was on subglottic stenosis, then what kind of stridor would you see? So if the question was on subglottic stenosis, you would get a biphasic stridor, meaning both inspiration and expiratory stridor. Now, a quick understanding again on the general rule of stridor. So when we talk about the general rule of stridor, what does it say? If there is any lesion or pathology above the level of vocal cords, it would always result in an inspiratory type of stridor, which is why in either laryngomalacia or epiglottitis, we would see an inspiratory stridor. But if there is any pathology affecting the thoracic trachea, the bronchus, the alveolus, so anything that's branching downwards in the mediastinum, whatever it is, would result in an expiratory stridor. But any lesion between the vocal cords and your thoracic trachea, which means your subglottis and the cervical trachea, in this lesion, if you've got any lesion, it would result in a biphasic stridor. So if I draw the image, any patient who has got a lesion above the level of vocal cords, what would happen? They would only get what type of stridor? Inspiratory. Any lesion of the thoracic trachea, the bronchus, the alveolus, what type of stridor? Expiratory. And any lesion between your vocal cords, the subglottis and the cervical trachea would result in a biphasic stridor. So here the question is asked either for subglottic stenosis, either for laryngomalacia, which you can confirm to me. So the answer is going to be, for subglottic stenosis, biphasic stridor. For laryngomalacia, it's going to be inspiratory stridor. So I hope all of you got this question. Let's go to the second question. So in bulla ethmoidalis drains in which of the followings? In the which of the following structures? So answer this in the chat box if you all know this. Yes, I'm waiting for your answers. So whenever we talk about the ethmoidal air cell, we have got an anterior most ethmoidal air cell. So this anterior most ethmoidal air cell is called as agar nasi. Now, behind the agar nasi, we have got a big ethmoidal air cell. This biggest ethmoidal air cell is called as bulla ethmoidalis. Now, this bulla ethmoidalis is a part of your anterior ethmoidal air cells. So, we all know that the anterior group of sinuses, whether it is frontal, whether it is maxillary, or whether it is anterior ethmoids, drain into which meatus? We know that they drain into the middle meatus. So the correct answer is going to be middle meatus. So this is a very simple question. So I see that there is a question by Pushpang saying that not drain or where is it located. So if they have even asked you about bulla ethmoidalis, it will be located in the anterior group of ethmoidal air cells. And if they have asked you about the drainage pathway, then it is going to drain in the middle meatus of the nose. The posterior ethmoidal cells will drain into the superior meatus. So posterior ethmoidal cells will drain in the superior meatus. In the inferior meatus, we have the drainage of the nasolacrimal duct. So I think this is the answer for the question. Okay, so if the question was located, then answer will be anterior ethmoid. So bulla ethmoidalis is an anterior ethmoidal air cell, so that should be your answer. Okay. So finally, of course, I'm going to take all of your inputs and we will modify the set of questions and we will put all your, whatever findings that you have told us and we will modify and come up with the revised thing on the app. Okay, so I think location tha, so if they have asked you specifically between middle turbinate, between the और लैमिना पेपरेसिया सुपीरियरली फोविया एथमोइडालिस ऐसे कुछ लोकेशन था या फिर एंटीरियर एथमोइड्स पोस्टीरियर एथमोइड्स ऐसा था सो आई थिंक दैट इज नॉट I don't know what was the question asked appropriately, but this is what I got in information. So I've answered that appropriately for that question. If there's more, we will discuss and please leave the, leave your inputs on the comment section. I will definitely take it up. Okay, so to Nishant, there are about 9 questions that came from ENT and there are 2-3 questions which I'm not sure. I'm going to discuss it out. And if the many students tell me that yes, are questions, then we will go ahead and discuss them. Okay, yeah. So an infant in neonatal, a neonate developed difficulty in breathing. His symptoms improve with crying. In which disease does the symptom improve with crying? So this was the question. Atrophic rhinitis, acute rhinosinusitis, allergic rhinitis, and choanal atresia. Dr. Aswa, if you think 15 questions the, so please let me know. So I've been able to get a recall of about 9 to 10 questions. Please help me with other questions as well. I'll be more than happy to help you with the answers. And definitely such sessions will help the upcoming students to get a recall of what happened in the previous years and give them an understanding of what they should be prepared for. So we're talking about an infant who developed difficulty in breathing and his symptoms improve with crying. So whenever we talk of lesions, congenital lesions of the larynx, especially if we are talking about laryngomalacia, or we are talking about laryngeal web, or if we are talking about subglottic hemangioma, which are all congenital lesions, we see that the stridor will worsen with crying. So what happens? The stridor will worsen with crying. But what happens in patients with choanal atresia? In patients who have choanal atresia, we see that stridor improves with crying. Why does it happen so? It's because in choanal atresia, especially bilateral choanal atresia, both the choana are blocked. So the nose no longer communicates with the nasopharynx. And as a result, the patient will have stridor at rest because infants are obligate nasal breathers. They do not know mouth breathing until, 3 months of age. So at birth, they will have stridor at rest. But what happens is on crying, they open their mouth and there is a negative intrathoracic pressure that pulls the air inside. And as a result, on crying, the patient's stridor will get relieved. So stridor improving on crying is a definite feature of choanal atresia. Okay. So I hope all of you got this. Okay, so I think that is the thing. Let's go to the next question. So there are people saying that there was question on supine and prone. तो अगर वैसा था तो choanal atresia में नहीं होता है. Supine or prone position, there is no difference in terms of stridor. In terms of laryngomalacia, in supine position there is worsening of stridor. In prone position there is improvement of stridor. So that's what we see in laryngomalacia. But if the question says that there's improvement of stridor on crying, then you should think about choanal atresia. Okay. Let's go to the next question. Which artery is the most commonly affected artery when there is a bleeding from the nose? Now, I think this was a pretty simple question. If this was the case, I don't know if this was exactly asked like this. So can you tell me if this was asked like this or not? Then I'll be able to tell you the right answer. So if the question was most common bleeding artery from the nose, you should think about what is the artery of epistaxis. So which artery is responsible for causing epistaxis? So if you know this, you'll be able to answer this. Exactly right. Muzammil, Abdul, Irka, absolutely right. The answer is going to be sphenopalatine artery. So sphenopalatine artery is called as the artery of epistaxis. So if there is a bleeding from the nose, the first artery that you're going to think of is definitely going to be sphenopalatine artery. So I think this was a question, and I think everyone is agreeing to me on this question, which means that it's a question. ऐसे ही था. Okay, so let's go to the next question. What investigation is carried out immediately after a child's lung has a foreign body? So if a child's lung has a foreign body, what is the first investigation or the initial investigation that you will carry out? So they're asking you immediately that you will carry out. Would you do a rigid bronchoscopy? Would you do a chest X-ray? Would you do a direct laryngoscopy, or would you do a flexible endoscopy? Yes, all of you have mentioned this. No mentioning of foreign body. Okay, so if they have given what is the investigation carried out for a child's lung lesion or whatever, I don't know what was the question. They asked about diagnosing bronchial asthma. Okay, I don't know if that was the case. If it was bronchial asthma, let me know again. Yes, in that situation also, I think a chest X-ray would be the first investigation that you would do. So here, the answer is going to be chest X-ray. So if they have asked you a foreign body, for foreign body, always and always X-ray is the first investigation. After X-ray, if the X-ray is negative, then you go for laryngoscopy, bronchoscopy, upper GI endoscopy to identify the location of the foreign body and to rule out the presence or absence of the foreign body. Okay. So I'm not sure. So I don't know. Some people are saying that as a question nahi tha. Some people are saying tha. So I don't know. But whatever it is, I think if they have asked you foreign body or if they have asked you asthma, what it was. But I think in both the cases, it is going to be a chest X-ray. Okay, so now let's go to the next question. A 54-year-old male presented with nasal obstruction. On examination, there was an irregular mass inside the nose. अभी ये भी question complete नहीं है. अगर आप लोग help करोगे तो I'll be able to get to the answer in a better way. मतलब ये question तो था, ऐसे बहुत सारे लोगों ने बोला. Many of you have told to me that there was a patient with a nasal obstruction. On examination, there was an irregular mass inside the nose. What is the possible cause? Okay, so they said that there was some protrusion through the choana. Okay, so they said that the mass was protruding from the choana. So if we think in any which case, if we are thinking about a mass protruding to the choana, and if they had given the question in terms of unilateral mass, and if they had given a choanal mass, if this was clearly mentioned, then you're going to think about antrochoinal polyp. Thornwold cyst is again a nasopharyngeal mass, not a choanal mass. Of course, it can extend to the choana, but it's a mass that you see in the midline of the nasopharynx. And hypertrophic rhinitis is a condition where you would see that the turbinates are enlarged because of various reasons like infection, inflammation, and that would again result in a lesion in the nose, not in the choana. So hypertrophic rhinitis definitely will not cause a choanal lesion. Thornwold cyst is a definite nasopharyngeal lesion. So अगर rule out करके answer को जाना है, तो फिर then the answer is going to be antrochoinal polyp. Okay. So I think that most of you have answered antrochoinal polyp. अगर language of the question में थोड़ा change था, but ठीक है. But the only thing that you should know is was the question asked on mass? Was the question choana? Was the question saying unilateral? And were these the options? So if these were the options and these were the keywords, there was a mass in the choana which was unilateral, then you should think about antrochoinal polyp. Although antrochoinal polyp is a disease that you see in young, it can be seen in patients who are older as well. Okay. Now let's go to the next question. अच्छा, so next question, I think there is ambiguity in different things. एक question था जितना मैं जानती हूँ on saddle nose deformity. If you remember and recall what was the details of this question, I will be able to help you. Okay, so there was a question on 3-year-old child. I don't know what was that 3-year-old child with foreign body. If they have asked you a 3-year-old child with a foreign body, then of course, you're going to think about X-ray as the first investigation. So this will be your first investigation. Okay, child having mild cold, and in investigation, they told the child has adenoid facies and asked the treatment. So if the patient has mild cold and if the child is having adenoid facies, so whenever the child is having adenoid facies, it indicates that there is a chronic adenoiditis. So when there is a chronic adenoid hypertrophy, it is going to cause mouth breathing, and mouth breathing will result in developmental changes in the craniofacial skeleton. So they'll have a long face, dull elongated face. They're going to have pinched lip, pinched nose, high arched palate, dental crowding. So these are all indications of chronic adenoid hypertrophy. It doesn't happen as a result of acute adenoiditis. Acute adenoiditis will never cause you adenoid facies. It only happens when the disease has been there since a long time. So if there is an adenoid hypertrophy that is causing this adenoid facies, of course, you will have to manage it with surgery. Immediate management, if the child is having cold, you will treat the cold and the URTI and then take the child for surgery. Okay. So if the question was adenoidectomy with curettage, adenoidectomy with microdebrider, there are different ways of doing. Curettage is a blind technique, so we will always prefer to do a technique that will visualize the adenoid and remove the tissue. So if poblator or debrider was given, then that will definitely be a better answer for answering this question. So here we are going to do a surgery where we can use either a poblator or a microdebrider. So this is the technique that we commonly use, and we are going to see the approach transnasally. So through the nose, you're going to pass the endoscope to visualize the adenoid. Through the mouth, you're going to pass the debrider to remove the tissue. Okay. तो अगर दोनों भी था तो poblator will be the best answer. If there was poblator, microdebrider, curettage, in सब में से best answer होगा poblator, because poblator is a bloodless technique. It will cut and coagulate the tissue simultaneously. Microdebrider assisted adenoidectomy can cut the adenoid, but of course it cannot stop the bleeding point. So again, you'll have to cauterize the bleeding point. So if they ask you the current treatment of choice, it's definitely going to be the poblator. Other option was breathing exercises and symptomatic treatment. Of course, a chronic adenoiditis se hota hai, so there is not much role of treating with medical management. Okay, so I think this question we are able to solve. Adenoid hypertrophy का तो अभी जाते हैं saddle nose deformity पे. What was the question on saddle nose deformity? I don't know. They have given you a question that what is the cause of saddle nose deformity, or why did the saddle nose deformity occur? Can you guys please tell me what was the options for saddle nose deformity? Or if you could help me with what was exactly asked here. Okay, so in saddle nose, they asked you about vaginous granulomatosis. Okay. Other than that, do you all recall any other options? See, of course, vaginous can cause saddle nose deformity because vaginous granulomatosis is a condition where you will see destruction of the entire septum. The bony septum and the cartilaginous septum is destroyed in vaginous, and hence that can result in a deformity, which could be a saddle nose deformity. Okay, they have given the word non-caseating granuloma. So if they have given you non-caseating granuloma plus they have given you saddle nose deformity, then the answer should be vaginous. Because non-caseating granuloma is a feature of vaginous. It's a granulomatous disease of the nose. So I think Arushi is correct and most of you are answering to that. So the other options were TB and they had given you leprosy. So TB, you get caseating granuloma. In leprosy, of course, you can get a deformity, but here it is usually we call it as lepra nose. We do not define it as a saddle nose deformity. But if they have given you non-caseating granuloma word specifically, then I would also prefer to go to the answer of vaginous granulomatosis. Okay. So I think these were the questions. Let me see if I can recall more questions with your help. I have, I think, few more questions. Let me just see what was there. I think there was a question on nystagmus. Let me just write it down. If I can help you, I'm just seeing through my WhatsApp what questions were asked from the students, that messages I have got. They had asked something regarding cows. There was a question on geniculate ganglion of the facial nerve. Now, I don't know what was this question. Now, they have also asked a surgery for nasolacrimal duct blockage. And I think, yeah, that's it. These were the extra questions which I think were there. So if you remember or recall anything of this, please tell me. Okay, so there's a question, a sudden breathlessness and stridor in a 3-year-old child. So if they have given you sudden breathlessness and stridor in a 3-year-old child, definitely your option should look for the presence of a foreign body. So younger children, toddlers, if there is sudden breathlessness and there is stridor, you must definitely rule out foreign body. So if these were the other questions, can you help me? So if they have given you a question on nystagmus, the question would have asked you cold water will cause nystagmus on which side, warm water will have caused nystagmus on which side. So the answer will be cold water will cause nystagmus towards the opposite side, warm water will cause nystagmus towards the same side. So I think that was the language of question. If it was, then let me know. So I'm waiting for your answers. What did they ask you exactly? Yes, and I'm also able to recall one more question which I see in my WhatsApp right now, that there is a patient who is having, autophony. The patient is having autophony where the patient is having echoing of her own voice. And the patient is having, on examination, the patient is having tympanic membrane, which is normal, moving with respiration. Correct? If this was the question, then they asked you what could be the probable cause. They had given you, if I'm not wrong, multiple sclerosis. These questions are just popping up on my window right now, so I'm just asking you these questions. Multiple sclerosis, weight loss, meningioma. Correct? If I'm not wrong. Was this question there? Yes, Dreamer, they have asked you. Yes, meningioma was there. Good. So I don't know if the options were the same or they were different. So when they have given you autophony and the TM is moving with respiration, meaning during inspiration it is bulging out and during expiration it is getting retracted. When does this happen? This happens whenever there is a eustachian tube that is spatulous. Spatulous means it doesn't have its own tone. It occurs whenever there is a loss of Ostman's pad of fat. So near the eustachian tubal opening where it opens in the nasopharynx, there is a pad of fat. This is called as Ostman's pad of fat. This Ostman's pad of fat, if it gets resorbed because of weight loss, the eustachian tube will have excessive mobility or it will be excessive patulous. So whenever air goes from the nose, it goes via the eustachian tube towards the middle ear during inspiration, pushing the tympanic membrane outside. During expiration, the negative pressure pulls the air inside the nasopharynx, causing retraction of the tympanic membrane. Okay? Yes, so Bala, I think you're right. Most of us are telling the same thing. So the answer should be weight loss. So multiple sclerosis, weight loss, meningioma, this was there. So the answer should be weight loss. So whenever there is a sudden weight loss, actually you will see this patulous eustachian tube. After pregnancy, we see again because of weight loss, you're going to see this. Okay, so this question is another question that we solved. Then sudden breathlessness and stridor, there is a lot of confusion. थोड़े लोग बोल रहे कि sternal retraction था, थोड़े लोग बोल रहे थे कि नहीं था, थोड़े लोग बोल रहे कि mild breathing breathlessness था. So if they have asked you the word sudden breathlessness and stridor, then you have to think about foreign body. Abhi endonasal DCR is done whenever there is a nasolacrimal duct blockage. So whenever there is a nasolacrimal duct blockage, you will have to do a dacrocystorhinostomy. What is dacrocystorhinostomy? We are going to open the lacrimal sac into the nasal cavity via the endonasal route. We can do an external DCR where we open the lacrimal sac externally. We can do an endonasal DCR where we open the lacrimal sac in the nasal cavity. So if they have given a question on nasolacrimal duct blockage, you must think about endonasal dacrocystorhinostomy. Yes, code blue, I think that answers your question. Yes, Ikra, ENT से काफी questions थे. अभी हम लोगों ने 5, we have been able to recall. इससे पहले there were about 7 questions. So 12-13 questions तो आए हैं ENT से, if I'm not wrong. Correct? So if I go back from the beginning, let's see क्या questions थे, so that confusion नहीं होगा और बाद में सही से पता चलेगा. So if I'm not wrong, they had given you which of the following stridor type is seen in the image. थोड़े लोग बोल रहे subglottic stenosis. Some of them are saying laryngomalacia. If it is subglottic stenosis, it is going to be biphasic. If it is laryngomalacia, it will be inspiratory. So what was there? I don't know, but of course I've given you the answer for both. Bulla ethmoidalis, you're asking me the location. So if I tell you the location of bulla ethmoidalis, it is a part of the anterior ethmoidal air cell. So the ethmoidal air cells sandwiched between the frontal sinus anteriorly and the sphenoid sinus posteriorly. Medially, we have got the middle turbinate. Laterally, we have got the lamina papyracea of the orbit. So if we take this as the orbit, we have got medially the middle turbinate. So bulla ethmoidalis is present between the middle turbinate, and laterally what do we have? We have got the medial wall of the orbit. So this would be the location per se if they have asked you. The next thing, where does it drain? It drains in the middle meatus of the nose. Now, if they give you an infant presenting to you with difficulty in breathing and this improves with crying, then the answer will be choanal atresia. If they have given you worsens with crying, then you can think about these 3 lesions if they were there in the options: laryngomalacia, laryngeal web, or hemangioma. And if they have given you position, then positional variation is only seen in laryngomalacia. Supine or prone ऐसे कुछ दिया था तो only laryngomalacia हो सकता है answer. Now, what is the artery of epistaxis? It is going to be, sphenopalatine artery. Okay, and then we had a patient presenting to you with a lesion in the lung, probably a foreign body. What is the first investigation? You're going to do a chest X-ray. Now, they gave you a mass that was irregular, protruding into the choana from the nose into the nasopharynx. Then you have to think about an anterochoanal polyp. Unilateral mass is something that you should always look for, anterochoanal polyp. If there was a saddle nose deformity, non-caseating granuloma, then you should think about vaginous granulomatosis, because it will cause destruction of the entire septum. Then 3-year-old child presenting to you with with sudden respiratory distress or stridor, first investigation again will be an X-ray. Adenoid facies will be something that is chronic adenoid hypertrophy, and here we are going to do a surgery. The surgery is the treatment of choice. Again, if the option was coblator, microdebrider, and curettage, you're going to do coblator-assisted resection as the first choice. Nystagmus, if it was given, cold water will cause nystagmus towards the opposite side, warm water will cause towards the same side. Geniculate ganglion ka question I was not able to get from all of you. NLD blockage will result in retention of the secretions in the lacrimal sac, necessitating you to do a endonasal dacrocystorhinostomy. So you can do an endonasal or an external. If endonasal was there in your option, that will be the answer. Okay, and sudden breathlessness, stridor ka ye question bahut bari there is a confusion, so let's leave it there. And autophonic question, I have told you where the patient is able to hear her own voice, her own breath sounds, and the TM is moving with respiration. The word TM is moving with respiration is enough for you to think about patulous eustachian tube. So this patulous eustachian tube is a condition where there is loss of fat at the nasopharyngeal end of the eustachian tube, resulting in air moving in and out, resulting in tympanic membrane movements during respiration. And that is what happens whenever there is an extreme weight loss. Okay, so Sonu, geniculate ganglion ka that some students said that was there in an option. Question ka pata nahi abhi tak. But abhi tak, as far as I can recall, these were the set of questions that came from ENT. So I hope this clarifies your questions, and this gives you an understanding of what were the PYQ topics, PYQ, things. Most of them we have already discussed, or we do discuss during our classes. So that I think that it was, of course, not extremely easy. I would say there were twisted questions. I will agree to it, but the topics were the same. So if you knew the concept, probably you would be able to answer. But having said that, I will just tell all of you that right now, do not get perplexed. Do not worry. I know Bala, paper 1 was untouchable. Paper 2 had a lot of questions of medicines. I have heard from students that syndromes were asked. Too many syndromes were asked. I don't know why such questions come and why they want to trouble you. I have no idea on that. But what we can only do is prepare to our best. And if it was difficult for you, it's going to be difficult for everyone around you as well. So let's hope for the best. Let's pray to God. Let's hope for miracles. Let's think that whatever 150 we did is enough to get you out there. And let's hope that everything is going to work in your favor. So just keep positive mindset. Just stay calm. Just stay relaxed. And I'm sure that you will come out flying with flying colors. And I'm going to hear from most of you and almost all of you that, ma'am, we did well in our exams and we cleared our examinations, and I'll be the most happiest person, and I will be there with all of you, whether good, whether bad. We are there with all of you, just by your side, to comfort you, to be there with you, to make sure that you are not lost in the crowd. Okay, so with this, I'll take your leave, and I will I'll see you all again. And if you are able to recall more questions, do leave them in the chat box. I will review them again. And, I will get back to you on the final question and answers on the application of PrepLadder. See you all. And the next session, we have Dr. Shanmuga Priya ma'am for biochemistry. She will be solving all the recalls of the biochemistry. And after that, we are going to have Nikita ma'am coming up with the radiology questions. And after that, last, we're going to have pediatrics. So stay tuned till the end to be able to get almost all the recall. And don't worry, life is full of, many joys. Let's see the positive side and let's leave whatever happened. And let's just hope for the best. Okay? So take care, everyone. I'll take your leave for now. Take care and bye-bye.
Good evening, all of you. So as you all know, this is an FMGE July 2023 Biochemistry recall session. And I know you're all too tired, right? After a long duration of preparation for this exam and after a long day when you have attempted like 300 MCQs. So we do understand your mindset. And the main purpose of this session, it is not to exactly discuss, so all the MCQs that are discussed in this PowerPoint are recall based, and the motive of this session is to get the actual questions asked in the exam. And after this, the exact question with the discussion will be uploaded on the app. But for now, we have successfully collected few MCQs. So we will be discussing those MCQs now. Okay. And you're more than welcome to share the MCQ that you can recollect related to biochemistry or even physiology. And you can include that in the live chat below. Okay. So comparison with Jan 2023 paper is, in the Jan 2023 paper, there were 17 biochemistry MCQs as against this time wherein we were asked only 9 MCQs, right? And we can hear you all shouting out how difficult paper 1 was. I did see what you are saying. Yes, there were many questions which were twisted. Though the topics were PYQ based topics, the question was totally twisted, and even a legendary person in biochemistry would find it difficult to answer those MCQs. I do understand that fact. So 1 second. You're not tired. I'm very happy to hear that, Sachin. I am happy to see such enthusiastic people in the crowd. So this time there were only 9 MCQs, but all the 9 questions were a bit twisted, and PYQs were 3 questions. So that is my observation. And with that in the background, let me start discussing these MCQs. This is the first question. Which of the following deficiencies associated with poor wound healing, dermatitis, diarrhea, and alopecia? This is definitely a PYQ. This was asked very recently in Jan 2023 MCQ. And during the recall session, I also told you whenever you see dermatitis and diarrhea, it is not always niacin deficiency, it's not always pellagra. Do you remember that? I said not only pellagra, even zinc malabsorption. What do you call zinc malabsorption as? Acrodermatitis enteropathica. So what does it present with? It presents with diarrhea and dermatitis in the peripheral areas, right? Acral distribution and in the periorificial region. But additionally, what you will also see in zinc deficiencies, there will be alopecia and poor wound healing. So all these put together, what will be the right answer, all of you? Very good. So I can see that Chandrapal Gupta has answered it as A, niacin deficiency. That is why I told you diarrhea, dermatitis, dementia is niacin deficiency. But do you see any dementia component here? Yeah, there is no dementia component here. Instead, what do you observe? You observe poor wound healing and alopecia. So this is acrodermatitis enteropathica caused by zinc malabsorption. So the answer is choice C. Okay. Yeah, greetings of the day to you too, Aradhana. So the next MCQ is this: delayed wound healing after a minor surgery is due to deficiency of. So this is vitamin C. So why am I saying this is vitamin C? As we have already learned that vitamin C is necessary as a coenzyme for prolyl hydroxylase and lysyl hydroxylase. And as we all know, both these enzymes are necessary for post-translational modifications of collagen. And collagen is necessary for wound healing. So poor wound healing is not only related to zinc deficiency, it's also related to vitamin C deficiency. Zinc deficiency causes poor wound healing because zinc is necessary for metalloproteinases. And vitamin C is necessary for what? It is necessary for prolyl hydroxylase and lysyl hydroxylase. So answer here is vitamin C. The next question, it is totally tricky, I understand this. A farmer sprayed a chemical in the pool which causes inhibition of complex 3 of electron transport chain. Identify the inhibitor is the question. Okay, so choices provided were rotenone, BAL, cyanide, antimycin. So what did you all choose? The answer is, it is not cyanide. Yeah, so a farmer has sprayed a chemical, right, in the pool. So fishery, yeah, in fisheries they use a pesticide, they use an insecticide which is antimycin. And antimycin is a derivative of streptomycin which is used in fisheries. And what does it do? It acts by inhibiting electron transport between complex 3 and cytochrome C. So what is the right answer here? The right answer here is antimycin, that is being used by farmers, which they spread over or spray over the pool because it acts as an insecticide in fisheries. Okay. So answer is antimycin, which inhibits electron transport between complex 3 and cytochrome C. Okay. Cyanide will not be sprayed by any farmer. So farmer is the clue that is given to you. In question, it was not there as complex 3 inhibitor. Yeah, I was also told that all these inhibitors were paired with the complex. And I'm very sure that antimycin was coupled with complex 3. Do you remember that? Antimycin was coupled with complex 3 and that is the right answer. So the only clue that is given to you here is farmer and pool. And the answer is going to be antimycin. This is why I always say do not just memorize the answer for PYQs. Whenever you learn about PYQs, just remember and try to understand relevant facts and concepts. You should know what is antimycin. You should know what is rotenone. Rotenone is a rat poison. So how does this rat poison act? It acts by inhibiting electron transport between complex 1 and Q. And how did I ask you to remember this? Rotenone sounds like vitamin A. Right? The first alphabet is A. So rotenone is between complex 1 and Q. Okay. BAL has got 3 letters and it inhibits electron transport between complex 3 and cytochrome C. Cyanide inhibits electron transport between complex 4 and oxygen. So what is the right answer? Answer here based on the function, the answer here is antimycin between complex 3 and cytochrome C. One more clue was there. It was odorless powder. Okay. So antimycin is definitely an odorless powder which they spray on the pool. So always remember about all these inhibitors and their functions. Okay. So this is the next question. A patient with a history of chronic alcoholism. This is a very simple question, right? With the history of chronic alcoholism is admitted to the hospital with symptoms of confusion, ataxia and ophthalmoplegia. So don't you think this is nothing but the GOVA of Wernicke's encephalopathy? What is GOVA? I've already told you so many times. GOVA stands for global confusion. O stands for ophthalmoplegia, A stands for ataxia. Put together, this is Wernicke's encephalopathy, which is caused by what? Acute thiamine deficiency. So I've told you alcoholism. Alcohol is a source of empty calorie. It gives you more energy, but it's not loaded with micronutrients. So anybody who consumes alcohol will end up in excess energy without micronutrients. So there will be micronutrient deficiencies. Of all the micronutrients, the first micronutrient to become deficient in a chronic alcoholic is thiamine, because alcohol interferes with thiamine absorption. So what is the right answer here? The right answer here is vitamin B1. In the previous question was mentioned with complex 3. Yes, antimycin inhibits electron transport between complex 3 and cytochrome C. So the answer is choice D. Okay, Gurmeet. Okay, so answer for this question is vitamin B1 or thiamine because of the characteristic presentation. Had it been B12 deficiency can also be a feature of chronic alcoholism for the same reason, micronutrient deficiencies. But if that is the case, they will present only with neurological manifestations and macrocytic anemia. Had the presentation been something like subacute combined degeneration, when you see sensory neuropathy, motor neuropathy, cranial nerves are all involved, then it is subacute combined degeneration with macrocytic anemia. In that case, it is B12. Okay, so answer here is choice A. You cannot hear you, video is not working. Is the video not working, all of you? Probably Aradhana, you have to refresh it from your side. Try doing that. So the next MCQ is a neonate born out of full-term normal delivery. Thank you. So neonate born out of full-term normal delivery is mother-fed. The neonate presents with hypoglycemia. So in all my sessions, I've told you, do not be scared. Do not be perplexed seeing a case-based MCQ. Whenever you're given a case-based MCQ, follow 2 steps. Step number 1, summarize positive findings. Step number 2, exclude choices. So let's try to follow step number 1. The first positive finding is a child who is mother-fed. Point number 2, presents with hypoglycemia, hypophosphatemia, lactic acidosis and mild icterus. And then point number 3, urine answers Benedict's test. The most probable enzyme defect is, I see that many of you have answered it right. Yes, it is galactose 1-phosphate uridyl transferase defect. Yeah, the reason is, the first is mother-fed. Mother's milk has got lactose. Lactose gets digested to give galactose and glucose. And galactose entry is presenting with hypoglycemia, hypophosphatemia, lactic acidosis. And urine answers Benedict's test. Based on this, I'm going to exclude choices. This is not lactase deficiency, because lactase deficiency is a digestion defect. If it's a digestion defect, then the child presents with only gastrointestinal manifestations. The child would have presented only with diarrhea. Do you understand this? They present with osmotic diarrhea, they present with bloating, flatulence and frothy stools. Here it's a metabolic defect. So this is not lactase deficiency. This is not fructokinase deficiency, because fructokinase deficiency is called as essential fructose urea. And if it is essential fructose urea, as the name indicates, it's essential because they don't present with any of these manifestations. The only finding is fructose will be found in urine. It will be an accidental finding that the child's urine answers Benedict's test. But here that's not the case. The child has presented with multiple manifestations. That is why it is not fructokinase deficiency. Okay, now can it be galactokinase deficiency? Because I saw that Danish Akhtar had answered it as C, right? So oil drop cataract, very good. So if there was oil drop cataract, then all the more the answer is classical galactosemia. Yeah, so oil drop cataract, what is the cause? It is classical galactosemia caused by the defect of galactose 1-phosphate uridyl transferase. Had it been galactokinase deficiency, it would have presented only with oil drop cataract, nothing else. They do not present with hypoglycemia, hypophosphatemia or lactic acidosis. And that is why what is the right answer? The anti-mycin question is incorrect. I'm more than happy to get the question from you. The question just said the child ingested white powder sprayed by farmer and the options had various inhibitors. Okay, so farmer powder, it is anti-mycin. Is that clear? So based on the inputs that I get from students, I frame this question, but I'm happy to get your question format. Yes, even in that case, it is anti-mycin. Okay, disease was asked with oil drop cataract. If the disease was asked, then it is classical galactosemia. Okay. So did you all answer this question? Identify the pattern of inheritance depicted in the pedigree chart. What is the answer? The option is galactosemia. You're right, speck of dust. So pedigree chart, let's look at the chart. Let's try to find out few positive findings in the chart. So in the chart, do you see male to male transmission? All of you, do you see male to male transition happening here? Okay, that is point number 1. And point number 2 is, though both the parents have got the disease traits, yeah, both the parents have got disease traits, but in the first generation, do you see that one child has escaped from the disease? Okay, in that case, what would be the right answer? Let's exclude choices. If there is male to male transition, then the first thing that I would exclude is X-linked recessive or X-linked dominant. Had it been X-linked recessive or X-linked dominant, when the father is affected, only the X chromosome is affected. In that case, the child, what do you think? Will the child get the X from the father? The child will not get the X from the father. So if there is male to male inheritance, then this is not X-linked recessive or X-linked dominant. And then I'm going to exclude autosomal recessive condition as well. The image is not correct. The transmission was predominantly mother to mother. This was not the pedigree. If this is the pedigree, then the answer is Okay, in exam it was autosomal recessive. Okay, never mind, I will try to collect the right pedigree chart, but for now let's try to understand how to answer when such questions are asked. Yeah, the first thing that you check is that male to male inheritance. If there is male to male transition, it's not X-linked. And when both the parents are affected, if one of the children is not affected, this is not autosomal recessive. Because if it's autosomal recessive, for both the parents to be affected, they should have both the alleles to be mutated. When both the alleles are mutated, then all the children should be affected. That is how we have to exclude choices. Okay. If this is the pedigree chart, then it is autosomal dominant. If this is not the pedigree chart, then use these rules to answer that question. Does that help you? Okay, agreed. If the image is not correct, I'll change the image. But this is how you have to answer it. Okay. Because this is based on how a student gave me this image. All 3 generations were affected. Okay. So this is a PYQ, right? Yeah, I myself have discussed this in many PYQ sessions, the drug of choice for mountain sicknesses. What is the answer that you all chose? Yeah, the answer is, thank you, Vicky Kumar Thakur. What is the answer? It is acetazolamide. Right? So why is acetazolamide given for mountain sickness? The predominant reason because of which you're worried about mountain sicknesses, when a person climbs uphill quickly, the person hyperventilates and the person ends up getting respiratory alkalosis. So to treat mountain sickness, your aim should be to induce acidosis. How can you induce acidosis? By giving acetazolamide. Acetazolamide is a carbonic anhydrase inhibitor which does not allow bicarbonate to be reclaimed in the PCT. If you don't reclaim bicarbonate in the PCT, all bicarbonate get lost in the urine. Without bicarbonate, there will be metabolic acidosis. So why do you prescribe acetazolamide for mountain sickness? Because acetazolamide causes normal anion gap metabolic acidosis, which counteracts the respiratory alkalosis that happens in mountain sickness. So the drug of choice is acetazolamide. Okay. There was skipping in the generation pedigree. Okay. If there is skipping, then it is autosomal recessive. Okay. There were 2 questions, height. One was about height, one was mountain, and one was 2 friends climbing and some other. Can't remember quickly. Okay. So this is another question about which we have discussed so many times in all our sessions, right? Which of the following intermediates of citric acid cycle is formed from aspartate? I've asked you to have a mnemonic for it. The mnemonic is SO. What does SO stand for? Aspartate on transamination forms oxaloacetate. Do you all remember that? Yeah, the mnemonic is SO. What does SO stand for? Aspartate on transamination forms oxaloacetate of citric acid cycle. I also have given you a statement to remember what are the intermediates which amino acids give rise to in citric acid cycle. The statement is CATS succeed funny oxes. Remember, CATS stand for alpha ketoglutarate. Succeed stands for succinyl-CoA. CATS succeed funny fumarate. Oxes oxaloacetate. Okay, and out of this, succinyl-CoA is formed from what? Vim amino acids. What are the Vim amino acids? Valine, isoleucine and methionine will only give rise to succinyl-CoA. It's not the aspartate. What does aspartate give rise to? It gives rise to oxaloacetate. So answer for this question is choice C. Okay. Fumarate is formed from phenylalanine and tyrosine. Okay. So this is an interesting question. Cholera toxin causes all questions and options are wrong. Yeah. So when I started the session, I gave you a disclaimer, Mohammed Karimuddin. Yeah, the disclaimer was all these are based on recall. And the ultimate aim of having this session is to help you understand what kind of questions were asked and how to answer such questions. And for you to understand whether you've made right or wrong. Okay, so it's not about having an exact replica of the question that was asked, and in due course we'll be collecting the exact question and that will be uploaded in the app. Okay. Yeah, what is answer? Cholera toxin. Very good. Many of you have answered it right. It is GM1 ganglioside receptor. Okay, answer is choice C. Cholera toxin causes diarrhea by acting through which of the following receptors? It is GM1 ganglioside receptors. So this also I've discussed in many of my sessions. Cholera toxin causes ADP ribosylation of which receptor? GM1 ganglioside receptor. So this is a GM1 ganglioside receptor. A cholera toxin causes ADP ribosylation of this GM1 ganglioside receptor, and this receptor is a GS coupled receptor. And the effect of ADP ribosylation is that the GTPase activity is inhibited. So continuously it is attached to GTP. As long as it is attached to GTP, cyclic AMP will be continuously produced. This cyclic AMP opens which channel? Chloride channel, because this was asked in the previous year. The question was mildly different. They asked you which channel is affected in the presence of cholera, and that answer is chloride channel. That is why I said it is not like there were no PYQs. I know that all of you said there were hardly any PYQs, but I would say there were previous year question based topics, but the question was twisted. Okay, so previously they asked you cholera toxin causes inhibition of which channel? Chloride channel. Now they asked you which receptor does it act on? It acts on GM1 ganglioside receptor. Okay. So these are the questions that I was given or I was able to collect from students, and I know that there was another question which asked you about thymine-less cell death. Did you all answer that question? Yeah, there was a drug. There is a drug which gets converted to an active inhibitor, after which it causes thymine-less cell death. So thymine-less cell death is caused by 5-fluorouracil. Do you remember that? 5-fluorouracil causes inhibition of thymidylate synthase, because 5-fluorouracil is a structural analog of uridine. Okay, and it causes competitive inhibition of thymidylate synthase, and without thymidylate synthase, thymine cannot be synthesized, and that causes thymine-less cell death. So answer for that question would be competitive inhibition. This was given to me very late, and that's why I've not included that in the presentation. And these are the 10 MCQs which I got from biochemistry, asking GLUT transporters, different options, internal membrane transport. GLUT transporters, what do you mean by internal membrane? Transmembrane transfer. Did they ask you about which GLUT transporter is present in which cell? Trinucleotide repeat. If you can recollect the question on trinucleotide repeat, I'll be happy to tell you that. Arushi Singh. Question 8 you didn't see? Maybe I didn't. This is the question 8. Yes, citric acid cycle is formed from aspartate. It is oxaloacetate. So what was the question on trinucleotide repeat? Did they ask you CAG repeat is seen in which disorder? CAG repeat is seen in spinocerebellar ataxias and in Huntington's chorea. CTG repeat is seen in myotonic dystrophy, right? And then GAA repeat instability is seen in Friedreich's ataxia. Was that asked? Huntington's chorea? Yeah, Huntington's chorea is CAG repeat. So the disorders which are associated with microsatellite instability would include spinocerebellar ataxias, Huntington's chorea. Myotonic dystrophy is associated with CTG repeat instability. Friedreich's ataxia is associated with GAA repeat instability. And then Fragile X syndrome is associated with CGG repeat instability. And apart from this, also remember, hereditary non-polyposis colon cancer is also characterized by microsatellite instability. So if you had seen any of these choices, then that is the right answer, Huntington's chorea. In question, they didn't mention CGG, they mentioned only trinucleotide. Then the answer is Huntington's chorea. Okay. GLUT transporters. What is your doubt about GLUT transporter, Bashra Ali? Okay, if it's trinucleotide, then it's Huntington's chorea. Not that easy about GLUT. It was transmembrane transport of glucose by GLUT 1, 2, 3. Okay, lateral transport was the question. Okay. If it's about lateral membrane transport, it is GLUT2. Was that the question? Lateral flow of glucose across the cell. Yeah, lateral flow of glucose across the cell, then it is GLUT2 transporter. Did you find GLUT2 in the choice? If you found it, then that is the right answer. Okay, I hope I have answered all your questions. So trinucleotide repeat is one question, the other one is lateral transport. Okay. So thank you all. So do not be worried about how you have performed your FMG exam, because you have done your best, right? Both during your preparation phase and in the exam hall, you have done your best, and now you are here to find out the key. So just remember, it's just 50% that is expected out of you. Yeah, and you're far better than that. So relax, have a good evening, and have a good few days until the results come out. And even after that, I'm very sure you'll be successful. Okay, my best wishes. Increased homocysteine. Thank you, Vicky. If it was increased homocysteine, what were the choices Arushi Singh? Did they ask you about vitamin B6 and vitamin B12? Or was that about enzymes? If it's about enzyme, it is cystathionin beta synthase defect, or it is methionine synthase defect. Okay, it is either because of cystathionin beta synthase or it's because of methionine synthase defect. If it's vitamin, then it is vitamin B6 or B12 or tetrahydrofolate. Cystathionin beta synthase would be cystathionin beta synthase defect causes type 1 homocystinuria, and that responds to B6 administration. In that condition, homocysteine will be excreted in urine, and they present with accelerated atherosclerosis, accelerated thrombosis, and with skeletal deformities. So answer is cystathionin beta synthase. Yeah, I know. I don't deny that fact, Bala. Yes, questions were twisted, not only in biochemistry, in almost all the subjects, questions were a bit twisted. But probably they are trying to get you oriented to the forthcoming exams, right? So, because every exam gets more and more conceptualized and more twisted, I think they want you to get trained towards that expectation, okay? Otherwise, you will be able to clear it. Okay, you have got most of them right thanks to my videos. I'm very happy, speck of dust. I'm happy that you were able to answer many questions. You don't have to do anything, Rahul. Just relax, okay? You will clear it. Yeah, which enzyme deficiency causes homocystinuria? Just now I told you, Dwayne Jade, it is cystathionin beta synthase. Which enzyme lead inhibits in heme synthesis? That's a very good question. We have discussed about this. Lead inhibits 3 enzymes in heme synthesis. Number 1 is ALA dehydratase. Okay, the first enzyme is ALA dehydratase. Second enzyme is, have you heard of coproporphyrinogen oxidase? And the last one is ferrochelatase. All these 3 enzymes of heme synthesis are inhibited by lead. So did you see any of these choices? Bushra Ali. Did you see ALA dehydratase, coproporphyrinogen oxidase or ferrochelatase? All these 3 enzymes are inhibited by lead. We know everything and confident before, but after this exam, all questions asking treatment, ma'am. So take it from me, all the efforts that you have put in so far will not go for waste. Yeah, though you feel that it was tough, I'm very sure you must have answered many questions based on exclusion. Yeah, today you might think it was tough. Today you might think you failed yourself. Please, no. Yeah, you have done your best. You will be able to clear the exam. Yeah, my best wishes and my prayers for you all. It was asked which enzyme activity is increased. Really? I have not seen any enzyme activity to be increased in the presence of lead. Iron, I saw that there was a question on iron foreign body, right? So that is siderosis bulbi. If it was copper, that would have been chalcosis, because they asked you about iron foreign body. The answer is siderosis bulbi because of Fenton's reaction. Anything else? Ferrochelatase activities decreased. I'm very sure they gave ferrochelatase and enzyme activity decreased, and that is the right answer. Okay. ALA dehydratase, it's not overactivity, that's not the right choice. ALA dehydratase is inhibited by lead. Siderosis bulba is the right answer. Okay. One question was asked as something like, what gives oxaloacetate in citric acid cycle? Yes, oxaloacetate is formed from aspartate. Okay. So thank you all for being with me and for giving me few questions which I didn't have along with me before I started the session. So best wishes, just relax, just be happy. Okay, thank you, good night. In the first question you said, what did I say? Zinc is the answer, but how can niacin? Yeah, so I told you this Nakul, had it been niacin deficiency, it would have presented with diarrhea, dermatitis and dementia. The question did not have anything about dementia. Instead of dementia, the question included actually alopecia and poor wound healing. Poor wound healing is a feature of zinc deficiency because zinc is necessary for matrix metalloproteinases. That is why we should always compare and contrast between disorders. So pellagra and acrodermatitis entropathica are very similar to each other because both present with what? Both present with diarrhea and dermatitis. But pellagra presents with dementia and acrodermatitis entropathica will present with alopecia and with poor wound healing. That is why it is zinc deficiency. Have I answered your question, Nakul? And what was the question on hepcidin? Was it related to iron absorption? If the question was on hepcidin, if you want to know the function of hepcidin, hepcidin is a protein that is released by liver. And what does it do? It inhibits iron absorption along the basolateral side. So was there any choice related to it? Hepcidin, as the name indicates, hep stands for liver, right? So it's a protein that is released by liver and its main function is to go and inhibit basolateral side absorption of iron. And it's an inflammatory acute phase reactant. So whenever there is an inflammation, liver starts producing hepcidin. Hepcidin does not allow iron to be absorbed so that microorganisms do not get an access to iron. Okay. Was there a question related to it? Galactokinase is by prolactin oxytocin. What was the question on galactokinase? Galactokinase answered, right? The oil drop cataract. Yeah, oil drop cataract is caused by the deficiency of either galactokinase or it is galactose 1-phosphate uridyl transferase. So depending upon which choice you found in the question, you will have to choose one of the two. Okay. No problem, Abdul. When you can recollect, you can post that in my Telegram group. Actually, questions were more complex in comparison with what we are explaining here because we don't remember most of the info. Okay. Hepcidin interleukin. Okay, so interleukin increases, any interleukin for that matter, increases hepcidin release. Yeah, interleukin 6 increases hepcidin release that suppresses basolateral side uptake of glucose. Very good. That's a very good question because this is something which we came across during the latest COVID pandemic, right? So during COVID pandemic, we realized that cytokine storm causes release of interleukin 6 and this interleukin 6 causes an increase in hepcidin release and that causes decrease in iron absorption. So this is one of the reasons why there is anemia of chronic disease. You know, whenever there is chronic disease, there will be iron, something which resembles iron deficiency, right? That's because of hepcidin. What else? G protein coupled receptor. I told you GM1 ganglioside receptor and cholera. Recall language is easy, but in exam it was totally different language of questions. Yeah, I was told that the standard of language in which the question was asked was difficult. And many found it difficult to understand and to comprehend the question by itself. And I don't know why such questions were asked, but do not worry about it. All of you are in the same boat, okay? So everybody will clear, okay? Here is one more question. Which enzyme is needed for galactokinase? Enzyme, which hormone is it? Was the question on which hormone? Prolactin stimulates galactokinase activity. If there was an option of prolactin, then that is the right answer. Interleukin 6 would be a better answer. You can choose prolactin, Vinod Raj. Aspartate answer, it gives rise to oxaloacetate. Okay, yeah. Thank you all. See you sometime later. My best wishes and yeah, my prayers. Old topics, no more old topics, yeah. Yeah, this is what I've been telling every FMG aspirant. So do not fall prey for learning just PYQs, learning just frequently asked topics. You should switch over from factual learning to conceptual learning, but this is not the time to discuss about all of that. Yeah, just remember, you have done your best and you will be successful. Okay? Yeah. Thank you.
Hello everyone, happy evening and welcome back to another recall session. First of all, tell me whether I am audible and visible. Yes, okay. Thank you so much, Vinod, for that quick nod and confirmation. Amazing. Thank you so much. So, वापस आ गई Dr. Nikita with all of you guys basically now to discuss dedicated radiology questions. And before I start discussing the questions, I can truly understand, everybody who has given the exam today, what you must be going through when you want to see कि क्या सही हुआ, क्या गलत हुआ. Use these sessions as a learning session, guys, more so for your NEET PG exam, even if your exam has been great, because you would see a lot of interrelated topics and questions in the FMG and the NEET PG exam. And just hopes and prayers for each one of you that you clear the exam and we get a chance to interact personally and to, know your success story as well when the results are out. So all the best, everyone, for the results. Whatever is done and dusted, please don't overthink about it. काश मैंने ये आंसर यहाँ से ये A से C नहीं चेंज किया होता, मेरा एक क्वेश्चन बच जाता. Whatever you cannot change, whatever is not in your control, don't try to control that. Okay. Arushi saying this exam was just like FMG August 2020. Yes, it might be, but there were students who cleared that exam as well. So Arushi, count yourself in that league of the students who are going to clear the exam. Hena? So see, I was seeing the recall sessions as well are, and I would not totally agree the questions were very new. I agree the way the questions were asked were a bit tricky, were a bit difficult. But that is what I would like to reinforce again. अगर MCQ practice करते बहुत सारे questions practice करेंगे, so we will learn the art of how a simple topic can be twisted into a difficult question. The topics I've seen are the that are being asked in the past as well. Okay, so no, every suffering gaming mafia, remember that, is basically to help us learn and to help us grow, right? So take it in the positive sense. Okay, so yes, thank you so much, Bala, and let's start. That is what is the coordination that we have amongst each other, Bala, right? Chalo, let's start. Before that, a disclaimer, guys. There might be few questions which you might think, "Arey, ye to exam mein tha nahi." So there might be some questions like that. That does not mean that you have missed seeing some question, because this is totally based on the recall that we have got from the students. So that is why the purpose is to learn out of this session, right? And please help me get the correct questions. And with each question, whether it was there in the exam or it was not there in the exam, the purpose is to learn and grow. Okay, that is what is the only purpose. Okay, so let's start. And this is the first question that we have got from the recall that we have got from the students. Okay, so which nerve is damaged in this fracture? Chalo, so with every question, first of all, you will tell me whether you remember this question was there or was not there in the exam. Please do let me know there. Okay, was this question there? Yes. All right, so everybody is giving the correct answer here. Absolutely correct. It is, okay, that question was there. So this is a radial nerve. See, what fracture are we seeing here in this image is basically the humerus shaft fracture is what we are seeing here. The humerus shaft fracture, we know that what nerve is related to the shaft of the humerus. Humerus shaft, what nerve is related is the radial nerve going in the spiral groove of the humerus. Okay, that's a radial nerve which goes along the spiral groove. So that is why it's going to be radial nerve injury. Okay, great. So there was also the wrist drop image given along with that. So the wrist drop was also given, another clue that was given there, right? The Holstein-Lewis fracture as it is called. So remember the trick, we have discussed the mnemonic there. For your upper limb injuries, Dr. Kuma was the mnemonic that we have. Dr. Kuma, the D and the R, the drop is because of the radial nerve. The claw hand is because of the ulnar and the median nerve both, and the median nerve is what gives the ape thumb or the ape hand deformity. So even if you remember this mnemonic doctor, the drop is because of the radial nerve. In the past, let me quickly also discuss what questions have been asked. It is question was not there, option was there. So I believe there was a clinical question of the wrist drop, right? So there was a clinical image of the wrist drop, but the learning remains the same. So ulnar nerve injury, where do you see the ulnar nerve injury? Is the medial epicondyle. That is the question that has been asked in the past in both NEET PG, INI-CET, FMGE. So important there. Median nerve ka anterior interosseous nerve injury. That is what we see in supracondylar humerus fracture. And where do you see the axillary nerve? The axillary nerve goes around the neck of the humerus. So it is seen in fracture neck humerus, right? One question on nerve injury is bound to be there in the upper limb, whether it's a clinical question, is a fracture wala question, ya the splint aega, right? Ya clinical question aega, everything is going to be there, okay? Bilkul Banu Pratap, don't underestimate the power of mnemonics, right? Mnemonics do help you to remember the difficult and the confusing topics, right? This is where the mnemonic works. Dr. Kumar, the drop is the radial nerve. And mnemonics ke liye kuch nahi bolna. They are very, very close to my heart. Okay. Okay. So next question, going on to the next question. What do you think is, was this question there in the exam? Okay, same question with cubitus valgus varus gunstock deformity. So gunstock deformity again is supracondylar humerus fracture. Oh yes, correct, Bala. The mnemonic cows. Cold is opposite, warm is same side. Okay, thanks so much and same to you, Monica. Yes, okay, so this was there. A patient presents with chills and rigors and he has acute pain in the right flank region. Flank mein pain hai. So out of the options, if these were the same options, even if I'm not able to identify the image from the history of the pain in the flank, I would think it is something related to the kidney, right? Because cholecystitis will have hypochondriac pain. So in the image-based questions, especially the radiology questions I saw in the recent this year's NEET PG exam as well, the clinical history helps you to come to the answer. Okay, so this is, thank you so much, Devendra. Options were different. Okay, let's learn out of this. So what do you see here? The learning point here basically is in the X-ray, what do you see is this black colored air. You see the black color air. This is the shape of the kidney. You see some black areas in the kidney also. Black on X-ray, black on CT is air. So basically this is the air outlining the kidney. Wherever there is air, it is basically emphysema, like increased air. In the lungs is emphysema. So this is also emphysematous pyelonephritis. Okay, emphysematous pyelonephritis. If renal TB was there in the option, with renal TB, the image that they will give you is the putty kidney, that is the calcified kidney. So the putty kidney would be the white calcified kidney. If it was white, it is putty kidney. If it is black air, then it is emphysematous. Okay, then it is emphysematous. So options were renal TB, papillary necrosis, okay, papillary necrosis, renal TB, and you had renal TB, papillary necrosis and emphysematous pyelonephritis. Agar papillary necrosis answer hota, so they will not give you a plain X-ray image. It would be an IVP image at least that they will give you. It's a previous FMG exam question where you see the ring sign. They've asked you in the previous FMG exam. So basically it is the ring sign or the signet ring sign is what you see in the IVP. It would not be a plain X-ray image. Okay, it would not be a plain X-ray image. So depending on what were the options and what was the image in the exam, I've given you the clues on how to identify. If it's black, it's emphysematous. If it's white, then you think of putty kidney. And if it is IVP with the ring sign or something, then it is papillary necrosis. Very good, Abhi. For papillary necrosis, generally in the background, they would give you the history of the patient has taken NSAIDs, analgesic abuse, or sickle cell anemia, or a patient of diabetes mellitus. Something of that sort would be there. Okay, something of that sort would be there. Yeah, I'm coming to the next questions as well, which you have given here. Okay, so everybody is clear with this. At least समझ में आया कि next time question आया तो कैसे approach करना है. Black है कि white in radiology, that is the most important thing to identify. Okay. Right, so this session that we are having is based on the quote, one of my favorite quotes, which is, I am not teaching you, I'm not giving you the fish to eat for one day, कि बस ये fish खाओ और आज के दिन, satisfy your hunger. I'm teaching you how to catch the fish so that you satisfy your hunger today, tomorrow and forever. So I'm not just giving you like ready-made, ye answer hai. I'm telling you the tricks to learn so that in future, if you get a question twisted, you should be able to answer that. Okay, that is what this session is basically based on. Thank you so much, Bala. Okay, coming to the next question here, right? Like many of you are saying, this is the next image that was given. I don't think it was a straight one-liner question. So I believe there was clinical history given. Something like a child presenting with, was there bilious vomiting mentioned in the question? Was there bilious vomiting mentioned in the question? Options wrong hai. Options mein kya tha? Options were duodenal atresia. Okay, what was the other option? Other option would be CHPS, I believe. What else? Arushi, majority of the students said that double bubble was there. Okay, the next was the volvulus, duodenal atresia, volvulus, CHPS. Any other option which was there? See, if the question mentions bilious vomiting, and if there was one of the option of CHPS, I will rule that out because CHPS has non-bilious vomiting. Ruling out the options is the most important, the cheat code that comes to your rescue in the exam. Okay, so if there is bilious vomiting mentioned, then it's not CHPS because it gives non-bilious vomiting. Okay. Dusra wala, clinical history, that's why is important. If bilious is given, it's not CHPS. So look at the image here. Basically, this is the distended stomach. This is the duodenum. Beyond that point, because there is atresia, the air does not go distal to the atresia. So you are not seeing any air beyond. That is what is the concept behind single bubble, double bubble, triple bubble, multiple bubble. अगर stomach पे block हो गया, so it's gonna be single bubble. So CHPS or pyloric atresia will have single bubble. Duodenal atresia, stomach and duodenum, उसके बाद obstruction है, that will have the double bubble sign. Okay, that will have the double bubble sign. After duodenum comes the jejunum. So if it is jejunal atresia, it is going to be triple bubble sign. After jejunum comes ileum. So if it is ileal atresia, more than 3, basically it is going to be multiple bubble sign. So based on how many bubbles are given and what is the clinical history, you should be able to answer this question. Bilious vomiting is duodenal atresia with double bubble sign. Where else you see the double bubble sign is the annular pancreas. Okay, so imagine like annular pancreas is a circular pancreas obstructing the duodenum. So if you remember, this is the duodenum, this is where you have normal pancreas. If it is annular pancreas, it is encircling the duodenum, obstructing the duodenum, similar to duodenal atresia, it will give the double bubble sign. Okay, it will give the double bubble sign. Right? Clear with everyone? Clinical history pe dhyan do in the radiology images, because I'm telling you, I've seen it myself in the NEET PG exam this year. Many radiology questions can be solved based on the clinical history itself. You'll be able to rule out the options. Okay? And also remember the association of duodenal atresia with which syndrome? It is associated with Down syndrome. Okay, it is associated with Down syndrome. Chalo, koi baat nahi bala. You must have lost some marks there and you must have gained some marks somewhere. ठीक है? चलो, let's go on to the next question. Was there some question like this, guys? ऐसा कोई question था? ऐसा कोई question था? A patient presented after a road traffic accident with head injury, and this is X-ray nahi, ये CT scan है. What is the likely diagnosis? Something like that was there, or okay, Vinod, very good. Vinod is saying that there was a history of hit by a hammer. Okay, hit by a hammer, and if you see the image like this, so some heavy weapon, if it is hit on the skull, you can see that the bone is getting depressed. There's a fracture here. So basically this is a depressed skull fracture. Okay, this is a depressed skull fracture. If this is what not was the image, then what was the image? EDH का treatment पूछा था. अगर EDH का treatment पूछा था, if it was active EDH hemorrhage going on, then you have to decompress that craniotomy करके. Hit by hammer will be the depressed fracture. Okay, right. And also remember for your future exams, if they twist this question, in an infant, in a child, this depressed fracture is called as what fracture? Because the bones are very elastic. It is called as pond fracture or the ping pong fracture. Okay, pond fracture or the ping pong fracture, similar to the green streak fracture that you see in children. Because the bones are very elastic, they just get depressed without the actual fracture line that you see there. Okay, yes, I believe there are two different questions. एक question depressed fracture का, एक question EDH का. ठीक है? Burr hole करेंगे. Very good, Gaurang. If that was the option there, so basically burr hole करके उसको evacuate करेंगे हमारा EDH को. ठीक है? चलो, let's go on to the next question. ये image दिख रही है? Something of this sort was there in the question. Burr hole option नहीं था. तो क्रेनियोटोमी था ऑप्शन में, क्रेनियोटोमी था तो क्रेनियोटोमी रहेगा. बेसिकली इट इज द सेम, द मीनिंग इज द सेम कि उसको डीकम्प्रेस करो बेसिकली. चलो, was there? Okay, this was there. So what is the diagnosis here? Somehow in FMGE exam you would see this image coming time and again. This is favorite for the FMGE examiners. The horseshoe kidney. Okay, the horseshoe kidney, where you see that the two kidneys are fused together. They are coming in the midline. The bridge that is formed could be a parenchymal bridge or it could be a fibrous bridge. Okay, that is the horseshoe kidney. Okay, that's a horseshoe kidney. And again, remember the association of horseshoe kidney with which syndrome? Which syndrome? Very good, Ganesh. Correct. It is the Turner's syndrome. Okay, so horseshoe kidney is associated with Turner's syndrome. What sign do you see in the IVP? One kidney like this, other kidney like this. So the two kidneys coming together, this forms a flower vase appearance, or it forms the joining hands or the handshake appearance. It forms in IVP, है ना? और जो दूसरा है, दूसरा जो आर्टरी इसको ब्लॉक करती है, which artery is blocking the ascent of the kidney here? The kidney ascends in embryology. It is the inferior mesenteric artery. Okay, it is the inferior mesenteric artery. Gandharva Mishra, thank you so much for those kind words. है ना? बस इसके लिए हम आते हैं यहाँ पे YouTube live में. ठीक है, चलो. So that is the horseshoe kidney is what is the diagnosis here. ठीक है, चलो. Let's go on to next one. See, so these are the questions that I had got. Few other questions that I had got. So was there a question related to radiotherapy on related to LINAC? LINAC is basically linear accelerator. इस पे कोई question था? इस पे कोई question था linear accelerator पे LINAC वाला? कि what does the LINAC generate? Yes or no? Thank you, Gaurang. Yes, okay. So we have discussed this in our radiotherapy videos as well. LINAC is important because nowadays LINAC is the most common machine that is used for radiotherapy, and LINAC linear accelerator basically generates X-rays and electrons. Okay, basically it generates X-rays and electrons. So dependent on what option did you have, X-rays taki electrons, one of those you will choose, and this is basically used for teletherapy. Okay, this is used for teletherapy. Previously we had the cobalt machine that we used, but now commonly we use LINAC, and that is why X-rays are the most common rays that we use for treatment here. Okay. Yeah, Nakul, that is one of the defense mechanisms. So, koi nahi, you know, take every lesson in your life as a learning lesson. You know, not everything will go the way you expect in life. So just take your life like it's a movie, and don't try to be the director of your life, because you are just the actor and not the director. That is what I take my life as. I am just the actor in my life and God is the director, right? So I will not do any chhed-chhad with my movie of life, because I know that the director wants the movie to be a hit movie, right? No director wants the movie to be a flop movie. But kiski pehle hogi, kiski baad mein hogi, right? So just wait and watch. But most important is given your best efforts, whatever is in your control, apne taraf se puri mehnat karo. Then whatever comes your way, just accept it with the faith that this is in my best interest. So if you take life in that way, trust me, you will never be frustrated, or you'll never be sad. Take it like that. Okay, next one. We know the saying, we can learn anything, but relatives' pressures are more than parents' pressures. See, this is always going to be there. I think all of us would experience this sometime or the other. But at the same time, telling you from, whatever I've seen, my personal experience, at the end, it is your life and it is your story. और किसी को इतना फर्क नहीं पड़ता है कि आपके लाइफ में क्या हो रहा है, जितना हम सोचते हैं कि अरे ये क्या बोलेंगे, कोई कुछ नहीं बोलेगा. So if you are very confident, that you are doing whatever is right for your story, just keep moving on. I don't know, नकुल, हो सकता है एग्जामिनर्स ऐसे गलती करें. हाँ, देवेंद्र, very soon it will be there. ठीक है? Yes, very rightly said, Monica. So if it is not a happy ending, that means the movie has not ended yet. किसकी movie 1 घंटे की होगी, किसकी movie 3 घंटे की होगी, किसकी 10 घंटे की होगी, right? So someone will have that happy ending early, someone will have late, but सबका happy ending आएगा. चलो. Let's go to the next one. Inverse square law वाला कोई question था? Inverse square law वाला? Like which of the following statements is true, and one of the options was on inverse square law. That means as you increase the distance, basically the radiation reaching at a point decreases by square, something like that. No, it was not there. Okay, so ये किसी ने बताया था, maybe this was not there. ठीक है. It has to be craniotomy Abraham. If there's a midline shift which is significant there, then it has to be there. ऐसा कुछ नहीं था, ठीक है, जाने दो. ये वाला क्वेश्चन था, कोई ट्रॉमा का पेशेंट अनस्टेबल था और नेक्स्ट स्टेप पूछा था, एंड द ऑप्शंस वर लाइक ई फास्ट, एनसीसीटी, सीईसीटी. आई होप दैट क्वेश्चन वाज देयर, राइट? सो in a blunt trauma patient, basically whether the patient is stable or the patient is unstable, the first step is always E fast. The next step then depends on whether the patient is stable or the patient is unstable. If the patient is stable, that means you have time, you can evaluate further. So in that case, you can go ahead with CT scan. But if the patient is unstable, then you cannot wait and you will have to take the patient for exploratory laparotomy. Basically surgery के लिए patient को लेना पड़ेगा. So the first step, if it is asked, it has to be E fast first. Okay, it has to be E fast first. If E fast was not given in the option, then what were the options that were there? योगेश इज सेइंग कि एक एमसीक्यू था जिसमें हेड रेडिएशन का साइड इफेक्ट पूछा था. सो इफ यू हैव सॉल्व्ड द प्रीवियस ईयर क्वेश्चंस, आई विविडली रिमेंबर एक प्रीवियस ईयर क्वेश्चन ऐसा था कि हेड एंड नेक रेडिएशन का साइड इफेक्ट क्या होता है. वाज जीरोस्टोमिया देयर इन द ऑप्शन? Was xerostomia there in the option? Dryness of the mouth with head and neck radiation, if that was the question. Head and neck radiation, xerostomia. मुझे नहीं पता ये क्वेश्चन था कि नहीं. समवन इन द लाइव चैट कमेंटेड कि ऐसा कुछ था. हाँ हाँ, कपकेक डेफिनेटली. मैं तुमको छोड़ के कहीं नहीं जा रही हूँ. नहीं था, पता नहीं यार, वो बाद में ना हैलुसिनेशंस आते रहते हैं, पोस्ट एग्जाम हैलुसिनेशंस. आई कैन टोटली अंडरस्टैंड दैट. पता नहीं. चलो, सो yeah, I think guys that is all about today's discussion. Dhruv, if there was a question on head trauma, and what would be the next step? Head trauma mein it has to be NCCT first. Any head ka emergency first is NCCT. Investigation of choice for varicose gorang, it is ultrasound. उसमें हम valve competent है कि नहीं है, वेन्स कितनी डायलेटेड है, परफोरेटर कॉम्पिटेंट है कि नहीं, वो सब देखते हैं. सो अगर वेरिकोज वाला क्वेश्चन था, सो वेरिकोज वेन्स के लिए इट इज अल्ट्रासाउंड इज व्हाट वी डू. अगर हेड ट्रॉमा का क्वेश्चन था कि उसमें इन्वेस्टिगेशन कौन सी करते हैं, तो एनसीसीटी करते हैं. ठीक है, ओके. डुप्लेक्स ऑप्शन में था, सो यस, अल्ट्रासाउंड में यू कैन गो विद डुप्लेक्स. बेसिकली इट इज डॉपलर. सो पहले अल्ट्रासाउंड करते हैं, नॉर्मल ब्लैक एंड व्हाइट वाला बी मोड, फिर डुप्लेक्स करते हैं. ठीक है, पता नहीं, व्हाइट कलर ओल्ड टेलीफोन इमेज. विनोद, यू नीड टू शो मी द इमेज. डुप्लेक्स अगर ऑप्शन में था तो गो विद डुप्लेक्स वेरिकोज में. ठीक है. All right, guys. So thank you so much. That was a quick recall session in radiology. I did not want to bore you too much after the exam, but I hope the message is conveyed and the lessons are conveyed. Most important, do not worry about your past. Just focus on the future, but right now focus on the present and take a good break. You deserve a break. So just relax and remember, I'll be waiting to hear from you post results as well. Do not be a miser in sharing your good results post exam. Waiting to share your success story with everyone after the results are out. Okay, so Dr. S and everyone, we'll stay connected for our NEET PG preparation, guys. Even if your FMGE is done, we'll stay connected for your NEET PG preparation. All right, thank you so much everyone for joining in, and yes, goodbye, take care and keep studying and keep revising and keep winning. Thank you so much.
Hello friends, a very good evening to all of you. So I hope your exams went really well up to your expectations, right? So the first reviews that I get from this paper today, the FMG exam for which you appeared, the exam was more of a clinical pattern, moving now resembling more towards the next pattern, right? So I believe you all must be really tired, but we will quickly discuss the FMG questions from Pediatrics that came today, the recall based questions. So these questions may be different from the actual questions that were asked in the exam because these are based on the initial recalls that we are getting from you students. But yes, nevertheless, we'll discuss them because it is the time that you remember the questions very fresh. So it is very, very useful if you just recollect it once and then you can, just keep it aside and relax and rewind and you can take a really, really good break and enjoy, right? So we'll quickly, not going into very much detail, we'll just discuss the questions that we got till now from Pediatrics. So yes, so I hope my screen is audible and I'm visible. Please confirm. Data says no. Am I audible and is my screen visible? Please confirm so that we can move ahead. Is my screen visible and I'm audible? Please confirm. Thank you. Thank you, Pradanya, Devendra, Pratik, Johnny, Abhi, Salim. Good to see that you have got so much of energy, after giving this tiring exam, which was taking almost the more than half of your day, and then you are still, up and about discussing the recall. So we'll be very, very quick. I'll take not more than 10-15 minutes, right? So the first question which I got, what is the amount of milk given to a term baby in the first 24 hours after delivery? So we all know, for term babies in the first 24 hours after birth, how much fluid do they require? So term babies need, 60 ml per kg. Preterm babies need 80 ml per kg, right? So was this the question or any other question was there? So was it a term baby and in the first 24 hours after delivery? Yes? Okay. So one option was 20 ml per kg, Arushi says, but nevertheless, our answer here would be 60 ml per kg, right? Okay, very good. So the next question was a child with celiac disease, and it was asked whether the child is asked to avoid which of the following in diet: rice, wheat, oat, or pulses. So obviously, we all know celiac disease. There is, insensitivity to gluten, right? So there is sensitivity to gluten in celiac disease. So gluten is there in wheat. Okay, so wheat products need to be avoided, right? So, guys, was this the question? Or any other clinical details were also mentioned in the question, or were the options different? Suji was one of the options. Okay, Suji was option. Wheat was there in the option or not? Because Suji is also made of wheat, no? So, Suji was there in the option, semolina, and which of the child can eat was the question. Okay, okay. So, all except was there in the question. Okay, all except. Or the question would be which of these the child can eat. Okay, so suji or semolina was one of the options. Wheat was one of the options. What were the other options? So suji, of course, the child cannot eat, right? Wheat, of course, the child cannot eat. Yeah, we all know we need to avoid barley, rye, oats, and wheat. Oats, actually, if it is in very pure form, you can eat it. Right. The question was not avoided. Okay. So rice can be given was the answer. And we know so pulses was not there in the option. One option was suji. One option was wheat. Was oat also there in one of the options? Was oat there in one of the options? Yes. Oat was there. Okay. Pulse was not there in the option. Was oat there in the option or not? Yes, waiting for your replies. Yes, oat was there. So we know we need to avoid, barley, rye, oat, and wheat. So we will not give wheat, we will not give oat, we will not give suji, which is made of wheat. So the correct answer here would be rice. We would be giving rice. Okay. So the child can take rice. Okay. Right. So this was another question which I got. A child has presented with a birth defect as shown in the image. What is the diagnosis? So you can see the birth defect that has been, the picture that has been shared with me by you guys is like, there is a defect which is there. It is somewhat like anencephaly, but apart from that, there is a big defect of the spine where, the entire spine is exposed to outside. The spinal cord is exposed to outside, right? So this is a picture of craniorachis. Was this the image and this was the question? Yes, can someone please confirm? And what were the other options? So was this the image asked in the question, and what were the other options? If you can help me with that. Okay, so anencephaly with craniorachis. Okay, so if anencephaly with craniorachis is there, then that will be the answer. What were the other options? Yes, okay, so this was the same image. Thank you for confirming, Abhi, Jesse, Salim, right? Sam says the image was different. Can someone please confirm? So myelomeningocele was also one of the options. What were the other options? Myelomeningocele was one of the options. And what was the fourth option, if anyone remembers? So Disha says this was different. So if you can share the exact image, Disha, it will be helpful for everyone. Right? You can email me the image or you can share it in the comments here. Abdul feels the image was same, just other way round. Okay, just colored image was there, Salim is telling. Okay, right? So, okay, another option was anencephaly plus meningomyelocele, right? Anencephaly plus meningomyelocele. Okay. So, the correct answer here we have anencephaly with rachis, craniorachis is the best answer. Okay, thank you, Jessie, for confirming. Okay, so this, so many times we've discussed n number of times in different videos in different, platforms. What is the dose of vitamin A given in a child of 1 to 8 years? So we all know dose of vitamin A very, very important. So beyond 1 year of age, we know the dose is 2 lakh international units, right? So 2 lakh international units is the dose, and for prophylaxis of vitamin A deficiency, it is to be given every 6 months till 5 years of age. So every 6 months till 5 years of age, okay? And we begin it from 9 months with the MR vaccine. Then you give it at 16 to 24 months, and thereafter every 6 months till 5 years of age, okay? Right? So very good, Jesse. Yes, A is the correct answer here. The next question, what is the mid-arm circumference for severe malnutrition? Again, a cakewalk. Severe malnutrition, we all know the diagnostic criteria in a child between 6 months to 5 years of age, presence of any one or more of. That is weight for height. We know less than -3 Z score or less than 70% of expected, right? And mid-arm circumference less than 11.5 centimeters. And what is the third criteria? So edema. So bipedal symmetric edema of nutritional origin. So if any of these is there, we know it is SAM or severe acute malnutrition. Okay, nutritional origin. So we know the cutoff for mid-arm circumference is 11.5 centimeters. Again, very, very easy question. I'm sure all of you have done it correctly. And that vitamin A dose was, by the way, oral. Okay, right. Moving on, there was a case scenario of a child with bilateral oil drop cataract and the diagnosis was asked. Was this the question, or were some other clinical details also mentioned in the question, and what were the other options? So there was this question on galactosemia, right? And it was probably a case scenario, right? So it was probably a case scenario. So if any other details were mentioned in the case scenario, and what were the other options like? So of course, bilateral oil drop cataract gives you the diagnosis of galactosemia. Okay. But okay, so reversible cataract was mentioned. Okay, reversible cataract was mentioned. Any other details in the question? And what were the other options? Okay, classic galactosemia was one of the options. Classical galactosemia. Okay, urine had sugar but no glucose. Urine had sugar. That means reducing substance was positive in urine. Okay, non-glucose reducing substance, right? So classical galactosemia, congenital fructoseuria. congenital fructosuria. Okay, so case scenario was a neonate who had vomitings post feeds, who had vomitings. Okay, fructosuria, essential fructosuria. So congenital fructosuria, essential fructosuria were the different options. So Vinod Raj is telling height for age minus 2 SD, wasting stunting. Yes, there was one more question on that. I'll be coming to it. Okay, there was one more question on wasting. Okay. राहुल, इट इज विटामिन ए का ओरल डोज की बात कर रहे हैं हम, जो 2 लाख इंटरनेशनल यूनिट्स एवरी 6 मंथ्स देना है ओरली. ओके, नॉट IM, ओरली. ओके, सो बेनेडिक्ट टेस्ट पॉजिटिव, वी नो बेनेडिक्ट टेस्ट करते हैं नॉन शुगर रिड्यूसिंग सब्सटेंस के लिए. और दो ऑप्शंस क्या थे? एक तो गैलेक्टोजीमिया था, वन वाज कंजेंटल फ्रैक्टोज्यूरिया. व्हाट वर द अदर टू ऑप्शंस? और दो ऑप्शंस क्या थे? अगर किसी को याद है तो प्लीज लेट मी नो व्हाट वर द अदर टू ऑप्शंस. सो एक नियोनेट था जिसको वॉमिटिंग्स हो रही थी, बायलैटरल ऑयल ड्रॉप कैटरैक्ट था जो रिवर्सिबल था, यूरिन हैड शुगर बट यूरिन हैड रिड्यूसिंग सब्सटेंस, शुगर नहीं रिड्यूसिंग सब्सटेंस, है ना, reducing substance but no glucose. Benedict's test was positive. So what were the options? Okay, one was a very long one with uridine in it. तो गैल्ट एंजाइम होगा, गैलेक्टोज 1 फॉस्फेट यूरिडिल ट्रांसफरेज. ये था एंजाइम डेफिशिएंट गैलेक्टोज 1 फॉस्फेट यूरिडिल ट्रांसफरेज. सो प्लीज इफ समवन रिमेंबर्स द ऑप्शंस करेक्टली और एग्जैक्टली क्या क्वेश्चन है तो प्लीज शेयर कर देना इन द कमेंट्स बिलो. यू कैन शेयर और यू कैन ईमेल इट टू मी. आई विल बी शेयरिंग माय ईमेल इन द एंड, ईमेल आईडी. ओके, फिर नेक्स्ट क्वेश्चन. अ चाइल्ड प्रेजेंटेड टू द क्लिनिक विद कंप्लेंट्स ऑफ recurrent infections. Physical examination shows weight for height to be less than expected. Parents also have a history of incorrect feeding. ठीक से फीड नहीं करा रहे. व्हाट इज द अप्रोप्रिएट टर्म फॉर द अबव मेंशन्ड कंडीशन? वाज दिस द क्वेश्चन? तो वेट फॉर हाइट जो है इसका लेस देन एक्सपेक्टेड है. ओके, वेट फॉर हाइट लेस देन एक्सपेक्टेड है. तो अगर लेस देन -2 Z स्कोर मेंशन्ड था क्या क्वेश्चन में? इफ दैट वाज देयर देन वेस्टिंग वुड बी द करेक्ट आंसर. वेट फॉर हाइट लेस देन -2 Z स्कोर अगर था तो वेस्टिंग वुड बी द करेक्ट आंसर. ओके, सैम वॉज ऑल्सो वन ऑफ द ऑप्शन. आप कह रहे हो सैम भी ऑप्शन था और -2 Z स्कोर लिखा था या नहीं? सो हाइट फॉर एज वॉज लेस और वेट फॉर एज, अगर तो देखो हाइट फॉर एज कम था, हाइट फॉर एज अगर लेस देन -2 Z स्कोर था देन इट बिकम्स स्टंटिंग, है ना. हाइट फॉर एज कम होने से स्टंटिंग बन जाता है, वेट फॉर हाइट कम होने से वेस्टिंग बन जाता है. सो व्हाट एग्जैक्टली वाज आस्क्ड इन द क्वेश्चन? हाइट फॉर एज था, हाइट फॉर एज लेस देन -2 SD. ओके, तो हाइट फॉर एज लेस देन -2 Z स्कोर था, देन द आंसर बिकम्स स्टंटिंग. ओके, तब आंसर स्टंटिंग बन जाएगी. तो अगर हाइट फॉर एज लेस देन -2 Z स्कोर था तो आंसर स्टंटिंग बन जाएगी, और अगर वेट फॉर हाइट लेस देन -2 Z स्कोर है तो वेस्टिंग बन जाएगा. ओके, हाइट फॉर एज हम मान लेते हैं. थैंक यू एवरीवन फॉर कंफर्मिंग. फिर एक क्वेश्चन मीजल्स पे था. ट्रू अबाउट मीजल्स इन अ चाइल्ड इज कोराइजा कफ कंजंक्टिवाइटिस. तो हमें पता है मीजल्स में एक वेट काइंड ऑफ लुक होता है ना, खांसी भी होती है बच्चे को, रनिंग नोज हो सकता है, कंजंक्टिवाइटिस रेडनेस ऑफ द आईज होती है. और क्या था? और क्या ऑप्शंस में और क्या थे? और कुछ केस सिनेरियो था या एक सिंगल लाइनर क्वेश्चन था ये? सो ये जो क्वेश्चन ऑन मीजल्स था केस सिनेरियो था. ओके, रैश ट्रू अबाउट मीजल्स. मीजल्स लिखा था क्वेश्चन में? नहीं लिखा था. तो रैश था. ओके, लॉन्ग क्वेश्चन था. ओके, तो ये भी केस सिनेरियो था. ठीक है, तो आप टेलीग्राम ग्रुप पे भी डाल सकते हो, ठीक है, या फिर आप ईमेल कर सकते हो मुझे, या फिर इंस्टाग्राम पे मैसेज कर सकते हो. सो एग्जैक्टली क्या केस था वो? अगर रैश इज इन्फेक्टिव एंड देयर इज अ रैश. ओके, हाँ मीजल्स लिखा था आप कह रहे हो. इट इज अ सिंपल क्वेश्चन नहीं था क्वेश्चन. ओके, क्वेश्चन बड़ा सा था, लंबा सा था. ठीक है, लंबा सा क्वेश्चन था, केस सिनेरियो था जो कि जिसमें मीजल्स का डायग्नोसिस लिखा था. तो उसमें मीजल्स में हमें पता है कफ कोराइजा कंजंक्टिवाइटिस होती है. और क्या ऑप्शंस था? और क्या ऑप्शंस थे? अगर याद है किसी को एग्जैक्ट केस सिनेरियो क्या था, क्या ऑप्शंस थे? सो ये मेरा ईमेल आईडी है, अगर याद है तो प्लीज किसी को अगर याद आ रहा है तो ईमेल कर दीजिए dr.minakshi.pediatrician@gmail.com. और या फिर आप यहीं पे कमेंट्स के में शेयर कर सकते हैं एग्जैक्ट क्वेश्चन क्या था और उसके ऑप्शंस क्या थे, सो दैट हम उसको फर्दर डिस्कस कर सकते हैं. सो डेंगू रुबेला भी थे ऑप्शंस में. सो डेंगू आप कह रहे हो, डेंगू था, रूबेला था, डायरिया और राइनाइटिस थे। ओके, रैश स्टार्टेड विथ बैक ऑफ द ईयर। अच्छा, रैश बिहाइंड ईयर से स्टार्ट हुए जैसे मीजल्स में होता है। ओके, डायग्नोसिस करना था। ओके, डायग्नोसिस करना था। ओके, ठीक है। सो मीजल्स पे एक क्वेश्चन था जिसमें हमें डायग्नोसिस करना था। फिर ये एक क्वेश्चन था, अ चाइल्ड प्रेजेंटेड टू द क्लिनिक विद कंप्लेंट्स ऑफ मैल न्यूट्रिशन एंड सिवियर डिहाइड्रेशन, व्हाट वुड बी द चॉइस ऑफ आईवी फ्लूइड फॉर दिस पेशेंट। तो मैल न्यूट्रिशन वाले बच्चे को अगर सिवियर डिहाइड्रेशन हो जाता है तो उसके लिए आईवी फ्लूइड ऑफ चॉइस होता है आरएल इन 5% डेक्सट्रोज। ये क्वेश्चन था। अच्छा, मंकी पॉक्स भी था। ये क्या, फर्स्ट बेबी इन हैदराबाद, ये क्या क्वेश्चन था। पाम और सोल में रैश। ओके, पाम और सोल में भी रैश था। ये वाला क्वेश्चन बताओ, ये क्या क्वेश्चन था, ये क्वेश्चन था या और कोई क्वेश्चन था। मैल न्यूट्रिशन विद सिवियर डिहाइड्रेशन, द चॉइस ऑफ आईवी फ्लूइड इन दिस पेशेंट। डेक्सट्रोज नहीं था। ओके, अगर डेक्सट्रोज नहीं था तो फिर हम रिंगल एक्टेट यूज कर सकते हैं। अगर डेक्सट्रोज ऑप्शन में नहीं था तो फिर हम रिंगल एक्टेट कर लेंगे। डेक्सट्रोज वॉज डिफरेंट ऑप्शन, ओआरएस के 2 ऑप्शन थे। नहीं तो ये बताओ, चॉइस ऑफ आईवी फ्लूइड्स पूछा था या चॉइस ऑफ फ्लूइड्स पूछा था। आईवी फ्लूइड लिखा था कि आईवी फ्लूइड देना है। दिशा कह रही है यस, ये सेम था। सो बेसिकली अगर सिवियर मैलन्यूट्रिशन वाले बच्चे को डायरिया है, अगर तो डिहाइड्रेशन बहुत ज्यादा नहीं है तो हम ओरली ही देने का ट्राई करेंगे। ओरली हम रेजोमाल दे सकते हैं। ये सिवियरली मैलनरिश बच्चे को रिहाइड्रेशन सोल्यूशन फॉर मैलनरिश चाइल्ड, ये ओरली देते हैं। आईवी अगर देना है तो हम आरएल इन 5% एक्सट्रोज देना चाहेंगे। अगर वो अवेलेबल नहीं है तो फिर हम ओनली आरएल भी दे सकते हैं, बट ओनली डेक्सट्रोज नहीं देते। ठीक है, राइट। तो अब इन नेक्स्ट क्वेश्चन, इन विच ट्राइमेस्टर क्वाड्रुपल टेस्ट इज डन फॉर एंटीनेटल स्क्रीनिंग ऑफ डाउन सिंड्रोम। तो क्वाड्रुपल टेस्ट हमें पता है, क्वाड्रुपल टेस्ट जो है डाउन सिंड्रोम की स्क्रीनिंग के लिए किया जाता है और ये सेकेंड ट्राइमेस्टर में किया जाता है। फर्स्ट ट्राइमेस्टर में हम डुअल मार्कर्स करते हैं, सेकेंड ट्राइमेस्टर में हम ट्रिपल टेस्ट और क्वाड्रुपल टेस्ट करते हैं। तो ट्रिपल टेस्ट में हमें पता है, ट्रिपल टेस्ट जो होता है उसमें हमें पता है बीटा एससीजी होता है ना, अनकॉन्जुगेटेड ईस्ट्रेऑल होता है, अनकॉन्जुगेटेड ईस्ट्रेऑल और अल्फा फीटोप्रोटीन। और क्वाड्रुपल टेस्ट में 4 चीज होते हैं, इसके साथ हम इनहिबिन भी ऐड कर देते हैं। ट्रिपल टेस्ट की 3 चीजें प्लस इनहिबिन भी ऐड कर देते हैं। अच्छा, ये क्वेश्चन नहीं था आप कह रहे हो। नहीं, सिवियर डिहाइड्रेशन डुअल मार्कर कौन सा क्वेश्चन था। सो ये क्वाड्रुपल टेस्ट का क्वेश्चन था या डुअल मार्कर था, क्या क्वेश्चन था। अच्छा, 2 क्वेश्चंस ऑन मीजल्स, मीजल्स पे 2 क्वेश्चंस थे, तो 2 क्वेश्चंस क्या क्या थे, अगर किसी को याद आ रहा है कौन सा अलग क्वेश्चन था वो बता दो। अच्छा, क्वेश्चन ऑन नियोनेटल रिससिटेशन क्या था बताओ, क्वेश्चन ऑन नियोनेटल रिससिटेशन अगर किसी को याद आ रहा है एग्जैक्टली क्वेश्चन ऑन नियोनेटल रिससिटेशन क्या था बता दो। क्वाड्रुपल नहीं लिखा था बट बता दिया था कौन सा 4 था और पूछा कि किस ट्राइमेस्टर में था। अच्छा, तो क्वाड्रुपल नाम नहीं दिया था, आप कह रहे हो कि ये 4 इन्वेस्टिगेशन का नाम बता दिया था और कौन से ट्राइमेस्टर में करेंगे ये पूछा था। ओके, तो सेम ही मतलब बनता है ना। तो ये चारों चीजें हम करेंगे सेकेंड ट्राइमेस्टर में। क्वाड्रुपल टेस्ट था, वैश कह रहे हैं, आप कह रहे हैं। ओके, राइट। और एक और क्वेश्चन जो मुझे मिला, ट्रू अबाउट डाउन सिंड्रोम, तो इसमें क्या इमेज बेस्ड क्वेश्चन था क्या, जिसमें सीमियन क्रीज बनी हुई थी। डाउन सिंड्रोम पे कोई इमेज बेस्ड क्वेश्चन था जिसमें, तो ऑब्वियसली हमारा आंसर तो होगा 47XY और प्लस 21, मतलब क्रोमोसोम 21 का कॉपी एक बढ़ जाता है, ट्राइजोमी 21। सो क्या क्वेश्चन था ये। ओके, सो सीमियन क्रीज की इमेज थी। ओके, दानियाल सेज की सीमियन क्रीज की इमेज थी इस क्वेश्चन में। खाली सीमियन क्रीज की इमेज थी या डाउन सिंड्रोम के बच्चे के फेस की भी इमेज थी। सो सीमियन क्रीज इमेज वाज देयर। और क्या पूछा था, कैरियोटाइप पिक्चर पूछा था। ओके, खाली सीमियन क्रीज का फोटो था। बेबी हैड सीमियन क्रीज, तो बेबी में डाउन सिंड्रोम के फेशियल फीचर्स थे या नहीं थे, और ऑप्शंस क्या क्या थे। अच्छा, खाली हैंड का इमेज था। ओके, और ऑप्शंस क्या क्या थे, एक तो ये कैरियोटाइप का 47XY प्लस 21, ओके 47xy18 भी था ऑप्शन, 47xy18। और क्या ऑप्शंस थे? और कोई ऑप्शन अगर याद आ रहा है तो बता देना। क्रॉनिक इन्फ्लेमेशन विच इंटरल्यूकिन, पीडियाट्रिक्स का क्वेश्चन नहीं है, वेट कर लो, पैथोलॉजी का रिकॉल होगा, उसमें आपको पता चल जाएगा। ठीक है, सो आई थिंक मुझे इतने ही क्वेश्चंस मिल पाए जो अभी तक आप लोगों से रिकॉल में मिला। तो ऑलमोस्ट 11-12 क्वेश्चंस पीडियाट्रिक्स से अभी तक मुझे मिल गए। अगर कोई और क्वेश्चंस मिस हुए तो प्लीज बता दीजिए। व्हाट वाज द क्वेश्चन ऑन नियोनेटल रिससिटेशन, ये प्लीज कोई बताएंगे। डेवलपमेंटल माइलस्टोन से रिलेटेड कोई क्वेश्चन था या नहीं। और मीजल्स पे आप कह रहे हो 2 क्वेश्चंस थे, तो और क्या क्वेश्चन था वो प्लीज अगर कोई बता पाए, है ना। सो हैंड साइज वॉज स्मॉल फॉर एज इमेज गिवन बोल रहे। क्लाइन फिल्टर का क्वेश्चन था, ठीक है। क्लाइन फिल्टर वैसे पीडियाट्रिक एज ग्रुप में उतना ज्यादा नहीं इंपॉर्टेंट है। सो आप कह रहे हो बेबी का हार्ट रेट 55 SBP लेस देन 60 आफ्टर CPR एंड डोपामीन इन्फ्यूजन, ये हो गया। व्हाट विल यू नॉट डू, ऑप्शंस क्या थे बच्चे, ऑप्शंस बता दो। अच्छा, होमोसिस्टिन्यूरिया का भी क्वेश्चन था, डेवलपमेंटल माइलस्टोन्स का नहीं था। ओके, होमोसिस्टिन्यूरिया का एक क्वेश्चन था। क्या एग्जैक्टली क्वेश्चन था, अगर याद आएगा तो प्लीज बता देना, सो दैट हम लोग फिर से एक बार अच्छे से डिस्कस कर सकते हैं। तो ये मेरा ईमेल आईडी है dr.minakshi.pediatrician@gmail.com। ठीक है, तो आप अगर कोई क्वेश्चंस के ऑप्शंस अगर आपको लगता है कि कुछ और थे या क्वेश्चन में और कुछ था या और कोई डिटेल्स थे तो आप प्लीज शेयर कर दीजिए, है ना। और या फिर आप मेरे इंस्टाग्राम पे Dr.Minakshi_pediatrician पे आप मैसेज कर सकते हैं मुझे, या फिर आप टेलीग्राम ग्रुप ज्वाइन कर सकते हैं, या यहीं पे कमेंट्स के नीचे आप लिख सकते हैं। ठीक है, बट हैट्स ऑफ टू योर डेडिकेशन। मतलब यार दिन भर एग्जाम दे के पूरा सुबह 8 बजे से लेके शाम को 4:30-5 बजे तक आपको घर आते आते हम श्योर घर या हॉस्टल के रूम 5-5:30 तो कम से कम बज गए होंगे। उसके बाद भी इतनी शिद्दत के साथ बैठ के आप लोगों ने जो रिकॉल सेशंस अटेंड कर रहे हो, रिकॉल करने में हेल्प कर रहे हो, अपने जो जूनियर्स जो प्रिपेयर कर रहे हैं नेक्स्ट टाइम उनके लिए, आप इतना टाइम अपना एग्जाम के बाद भी इसमें लगा रहे हो, तो इट इज रियली कमेंडेबल। हैट्स ऑफ टू यू। तो आई एम श्योर आप लोगों का मतलब आप लोग इतना मेहनत आपने किया है, तो आई जस्ट प्रे टू गॉड दैट ऑल ऑफ यू आर एबल टू क्लियर दिस एग्जाम एंड कम आउट विथ फ्लाइंग कलर्स, है ना। तो आपका रिजल्ट बहुत अच्छा हो। तो ऐसे ही हार्ड वर्क सिंसियरिटी लगाते रहना है। मोस्ट ऑफ यू आर गोइंग टू मेक इट दिस टाइम, आई एम रियली श्योर अबाउट दैट। तो अपने रिजल्ट जरूर शेयर करिएगा। So I think it is time for you to rest now. So thank you so much for this recall session, for helping us out and for helping your juniors out. All the very best for your results. और अगर कोई questions हमने miss किए या कोई अलग questions है या कोई options अलग है तो प्लीज हमें फिर आप या तो यहाँ कमेंट्स में लिख सकते हो या फिर आप ईमेल कर सकते हो या इंस्टाग्राम पे या मैसेंजर पे मैसेज कर सकते हैं। ठीक है, सो अब हैव अ वेरी गुड नाइट, रिलैक्स, and now is the time to give time to your family, to your friends, and जो इतने सारे दिन आपने जो चीजें करने का मन था और जो नहीं कर पाए, तो प्लीज टेक टाइम टू डू ऑल दैट, राइट। थैंक यू सो मच, गॉड ब्लेस यू।